Good morning, good afternoon, good evening, wherever you're joining us from today. Welcome to the Global Health EDCTP3 Info Day for our 2026 work programme, Calls for Proposals. And apologies for some technical issues we experienced with the first link. We're happy you're able to join us now, and we're looking forward to this session. This is our 5th year of implementation and the penultimate work programme for Global Health EDCTP3. And thank you for the overwhelming interest that's been shown in this event and for the over 2,440 registrations received and 313 meetings accepted on our networking platform. We're delighted to have so many of you join us today. My name is Laura Pandia. I'm Team Leader for Strategic Partnerships and Communications at Global Health EDCTP3. And I'll be moderating this event, and I'm joined by a number of colleagues that will be co-presenting from the Joint Undertaking, the European Commission, and the EDCTP Association. Firstly, I'd like to cover a few housekeeping notices. So you can see, hopefully you've seen when you joined, that this meeting is being recorded. You are all muted, as are your cameras switched off. We're not able to see you or hear you, but you are able to interact with us by using the Q&A, and I'll talk you through that in a minute. So this recording of today's session will be published together with the presentations on the event page, and we'll also be circulating it through other communication channels. And you're also able, should you wish, to view live subtitles through this town hall, and that's available in English, French, Portuguese, Swahili, and Spanish. So as I said, although we can't interact with you live, we are able to receive your questions, and we will try to answer them. So you can see at the top of your screen the Q&A button. And here you can add any questions you may have throughout the event, and we will do our best to respond to them either in writing or live. You can also view questions from other people and vote for them. You can like them. If you like them, that's very nice, but actually given that we have limited time today and a large number of participants, we're unlikely to be able to work through all the questions live. So the best thing is to try and vote for questions that you would like to have most answered, and then we will work through in the order of the most upvoted questions. And you can do that by clicking on this little arrow button that you can see on the screen in the slide, and this will upvote and answer a question rather. So we have 3 live Q&A sessions throughout the program. And we will, anything that we're unable to work through today, we will respond to in writing. We aim to have Q&A documents that will be updated also on a weekly basis in case you have questions after this event that you also want to send us. So I'll now walk you briefly through the program for today, just to give you an overview of what we're going to be covering, and so that you can organise your time accordingly. The purpose of today's event is to really present the 2026 calls for proposals and eligibility conditions, to provide guidance on the financial, legal, and other funding aspects, including on contributing partners and the lump sum approach for coordination and support action calls, and to answer live as many questions as possible in the time we have available and in writing thereafter. And so I'm going to start with introducing Michael shortly for some opening remarks. Dr. Michael Makanga is our Executive Director. And after that, then I will give a short overview of Global Health EDCTP3. We will then have Jan Pala, who's the Policy Officer at the European Commission and the Directorate General for Research and Innovation, give an overview of the EU policy context around Global Health EDCTP3. And then Tom Nurienda from the EDCTP Association will talk about the role of the EDCTP Association. And these are our 2 governing partners for the joint undertaking. Then after that, we'll move into the detail of the work programme, and colleagues from our scientific operations team will walk you through the calls for proposals, and I'll introduce them then. We'll have the first Q&A session to cover everything that's come before that, a short break, and then we will talk about the different financial, legal, and contributing partner aspects for the calls. followed by a further QA, and then a specific session around the lump sum funding approach, which is applicable to the coordination and support action topics. After that, we have one last Q&A, and then we will wrap up. So yeah, we realize this is a long program, a packed agenda. You might not be able to participate for the full 4-hour duration, but hopefully this gives you an idea of what is going to be happening when, and what will be the most relevant parts for you to tune into. So with that, I'm now going to hand over to Dr. Michael Makanga. Oh, sorry, before I do that, let me just also inform you that this is the official English language info day for the work program 2026. But there are also, as in past years, language-specific info days that we organize together with colleagues in our member state countries. The first one is Portuguese language one that will take place on the 12th of February. The EDCTP Association is also organizing an information day as a coordinator of the Global Health EDCTP3 projects for 2026 calls. And we are also we're hoping that we can also organize some other language days, such as French and possibly Spanish, and more information will be shared on that in the coming days and weeks. So with that, I will now hand over to Dr. Michael Makanga for some opening remarks. Over to you, Michael.
Thank you very much, Lara. Distinguished participants, dear friends and colleagues, joining this meeting from various continents, it is a great pleasure to welcome you to the Global Health EDCTP3 Info Day. Thank you very much for taking time to join this session. I realize we have more than 2,400 people that have registered for the session. Well, we are living at a consequential moment of challenging geopolitics, and funding for global health is shrinking. However, with all hands on the deck, Global Health EDCTP3 and the European Union remain committed to supporting science, researchers, and innovators. As an organization, we listen, we analyze, and we act. In alignment with our strategic research and innovation agenda, and following a systematic and well-considered consultative process involving the EDCTP Association member countries, all European Commission directorates involving global health, our contributing partners, our advisory bodies, and a careful analysis of our prior investments, we have developed our work program for 2026. And the aspects of this will be presented to you today. And currently, we have 147 million available to fund global health research and innovation. And this will contribute towards 4 research and innovation actions, addressing the development of drugs for prevention and treatment of tuberculosis, the prevention and treatment of other lower respiratory tract infections other than TB, the better prevention, treatment, and clinical management of HIV and related comorbidities, as well as the global challenge of climate and health. This will also cover 2 coordination and support actions, supporting training and capacity development activities in areas of ethics, regulatory and pharmacovigilance, and enhancing integrated research and healthcare through digital innovation and artificial intelligence. Partnership is at the core of our work, and the critical role of contributing partners will be highlighted. This enables large-scale clinical studies through global collaborative actions, as well as co-funding for large-scale capacity development initiatives that are contributing to the broader global action plan of the World Health Organization on strengthening clinical trials ecosystem. I encourage all of you participants to ask questions, to seek clarification from the Global Health EDCTP3 team during and after the information day, and to network via the networking platform. And in conclusion, I invite all potential applicants to prepare well for the project proposals and to read the guidance that is available on our website. I wish you all good luck and hand over to the Global Health EDCTP3 team to take a deep dive into the program. Thank you very much.
Thank you, Michael. And with that, I will now take a few minutes to just give you a brief overview of Global Health EDCTP3. I'm not sure, we saw from the profile of many of you that registered that not everyone has been involved in EDCTP3 projects previously. So for some of you, this may be a new program. We were established, Global Health EDCTP3 was established in 2021. And we are the largest research funding partnership between Europe and Africa. We bring together the European Union which is represented by the European Commission, and the EDCTP Association, which is representing currently 15 European and 32 sub-Saharan African countries. And this partnership is really built on the idea that no country and no continent can achieve health security alone. And we are really based on a number of health strategies and priorities across the European and African continents. And we're building on our predecessor programs, the EDCTP1 and EDCTP2 programs. So you can see here that we have 3 decades of programs. Global Health EDCTP3 is the 3rd iteration, but our story began a long time ago in 2003 when we were established in response to the 3 main, in response to the Millennium Development Goals and the 3 main poverty-related diseases at that time, HIV, TB, and malaria. And we started small, and what started as quite a modest initiative has really grown into a true partnership of equals between Europe and Africa that has expanded its members, budget, and scientific scope across the years. Today, we're a joint undertaking between the European Union and the EDCTP Association with a total budget of 1.86 billion. Our disease scope has really expanded from the original 3 diseases to now also encompass poverty-related and neglected diseases, neglected infectious diseases, which are WHO's list of neglected tropical diseases, excluding those that are not prevalent in Africa, diarrheal diseases, lower respiratory tract infections, and infectious diseases of epidemic potential. And with this 3rd program, we also have areas of global health challenges that are really have greater emphasis in the program, such as antimicrobial resistance, climate crisis-provoked infectious diseases, digital health, pandemic preparedness, and co-infections and comorbidities with non-communicable diseases. On the next slide, you can see our governance. At its heart, Global Health EDCTP3 is about shared ownership and vision. We have African and European governments that are represented in the EDCTP Association, and they co-create our research agenda and work programs, ensuring that the priorities and investments reflect both perspectives from the African and European countries. And then the European Union is our other founding partner that provides half of our total budget. And we have 2 advisory bodies, the Stakeholders Group and the Scientific Committee, which help to shape our scientific and strategic priorities for the program and to give key input into our strategic documents, such as the work program that we're presenting today and other important events that we organise. And then alongside that, we have what we call contributing partners that come in on an ad hoc basis. They're not part of our formal governance structure, but they come in and co-fund or co-create calls and other activities with us. And you'll see a few examples of that today in a couple of the calls that are being presented. And we're delighted that we have, with us today, colleagues from the Coalition for Epidemic Preparedness Innovations, and one of our other calls is also being supported by the Leprosy Research Initiative. On the next slide, you can see our overall strategic approach. So we have 5 main pillars in terms of our strategy, and this is to advance biomedical interventions towards improved overall health, to develop research capacity in the continent of Africa, to enhance coordination and alignment of countries around a common strategic research and innovation agenda, and to strengthen capacity for outbreaks, epidemic, pandemic preparedness globally. And then we also have a 5th pillar that's around networking, building partnerships and strategic alliances. And across these 5 pillars, we have a number of different activities that we do to achieve them. And on the next slide, you can see how this is done. Our overall scope and integrated approach. At the heart of what we do is clinical research, but this is complemented by a number of activities to support the enabling environment for conducting clinical research in sub-Saharan Africa. And I mentioned already these global health challenges and the disease scope that you can see in the outer rings of this. But then we also are supporting a number of activities such as networking, fellowships, training, site preparedness, epidemic preparedness, supporting ethics and regulatory capacities, and the translation of knowledge from research into policy and practice. And then we also have regional networks of excellence that we've supported since 2008 that have not just recently received renewed funding and in a renewed scope. So we tackle all stages of clinical evaluation, particularly late-stage studies, with a special focus on vulnerable population groups and unmet medical needs. And alongside that, we're really strengthening the capacities and ecosystems, both in Europe and sub-Saharan Africa, to ensure that global health security is being increased. On the next slide, I just wanted to give you a flavor of our current portfolio. So 684 million has been allocated so far across the work programs 2022 to 2025. We have from this awarded 107 or signed 179 projects, and this is 413 million going towards 91 grants on clinical trials and clinical research activities conducted by European African consortia, and 17 million going to 16 grants for strengthening institutional capacities and the enabling environment for research in Africa. And of course, since awarding grants from our work program 2025, we are also expecting these numbers to grow in the coming months as grant agreements are signed with our new awardees. So the final slide I have is to just inform you about our upcoming forum. The EDCTP forum is a biennial forum. Many of you may have joined us in Kigali, in Rwanda, in June 2025. And there we announced that the next forum will be taking place in Spain. We now have a date. It will be the 5th to the 9th of April 2027. And we very much hope that you will be able to join us there. It's a great opportunity to present all your results and the activities that you are doing in your projects, and to meet other potential collaborators and grantees and funders as well. So we will share more information about that in the coming weeks, and look forward to seeing as many of you there as possible. So I think that was the last of the slides that I was going to present. And now I'm going to introduce Dr. Jan Paller. Jan Paller is the Policy Officer for the European Commission from the Directorate General for Research and Innovation. And as I mentioned earlier, he will be presenting the EU policy context to Global Health EDCTP3, representing one of our 2 governing partners in the joint undertaking. Over to you, Jan.
Yeah, thanks a lot, Lara, and welcome everybody. And the European Commission is very proud to be associated with the Global Health EDCTP3 as our primary wonderful partnership on clinical trials with Africa. And the EDCTP is also a key initiative mentioned under our EU Global Health Strategy, and also part, of course, of the EU Innovation Agenda, which is our main platform for collaboration with the African Union on research. Excuse me. So the Global Health Strategy was adopted in 2022 and then also endorsed by the Council of the EU member states in 2024, and rests on 3 pillars. One is to deliver better health and well-being. Then to strengthen health systems, which inherently, of course, includes research, and prevent health threats and pandemics through a One Health approach. And it's implemented through bilateral, regional, and global partnerships through a Team Europe approach, which means that the EU, as much as possible, is coordinating with the member states and their bilateral and national programs to make it a Team Europe initiative. On the next slide, I want to talk about the competitiveness agenda that the EU is currently pursuing, how to make the EU more competitive. And an important piece will be to strengthen Europe's clinical research ecosystem, as it was outlined in the life science strategy that the European Commission adopted in July 2024. And it's part of this overall competitiveness agenda that responds to important reports that have been drawn up by eminent figures, including Mario Draghi and Enrico Letta in their reports on proving EU competitiveness. And Mario Draghi in particular recommended the streamlining and the setup of management of multinational country trials. And in the Letta report, he mentioned that the single market can be a useful tool to streamline the clinical trial process, making the EU more attractive for clinical research investments. And then there is also a focus on how to support startups and SME in a new startup and scale-up agenda. And here, one focus will be to support biotech and health tech startups, particularly from the early research all the way through to clinical application, and expand trial networks, the infrastructure and partnerships, and encourage fast-track regulation pathways and funding access. As you will see on the next slide, a particular clinical research investment plan has been proposed and announced in the life science strategy that should facilitate funding for multi-country clinical trials, further develop and streamline European research infrastructure in the field of clinical research towards the goal of a single market for clinical research, both supporting non-commercial and commercial sponsors and complementing the regulatory measures that have already been proposed, included in the European Biotech Act that was launched in December 25. On the next slide, there is an overview of the overall support to clinical trials that is provided through Horizon Europe, which is the EU Research Framework Program, and mainly consists of the partnerships with the research partnerships with the member states and the associated countries, focusing on non-communicable diseases, on pandemic preparedness, and on rare diseases. And then we have the joint undertakings, most prominently, of course, the Global Health EDCTP3 with the partner countries in Africa, but also the Innovative Health Initiative, IHI, with industry. And then the EU Cancer Mission regularly calls for projects that are in the main work program of the health cluster, and supporting research infrastructure are part and parcel. And Horizon Europe, as the EU Research Framework, is inherently a global program. It brings together the EU and the ever larger number of countries that are associated to Horizon Europe. All countries can apply, all associated countries, and most of the lower and lower middle income countries are eligible for funding. And on the next slide, we want to make the case that the global research funding goes hand in hand with the large-scale initiatives under Global Gateway, which is the strategic framework of the EU to mobilize investment in key areas in partner countries, including on health. And in health, EU Health Partnership has been developed between Team Europe and the EU and several member states working together, aligning their national programs, and the African Union. And in health, there are 5 hubs, one on health security, another one on support to public health institutes, one on digital health, one on manufacturing and access to vaccines, medicines, and health technologies, and one on sexual and reproductive health and rights. And as you will see on the next slide, it's important to make the links to these hubs in your application as far as dissemination and exploitation and other means of how to link this with these important policy and funding initiatives. And I'm now going through some of them. On the next slide, more details on the One Health and Health Security Hub. I cannot go through them all in detail, but the slides will be there to provide more information, and also crucially the link where you can access more information on this initiative. So on the One Health, that strengthens health systems and capacity for sustainable prevention, preparedness and response, and brings together the EU and 6 member states to a tune of 430 million euros. The next slide on support to public health institutes strengthens the institutional capacity to national public health institutes, promoting regional collaboration and networking. And that brings together the EU and 11 member states to the tune of 140 million. On the next slide is the one for digital health to accelerate the health system strengthening and the achievement of universal health coverage through digital health initiatives, brings together the EU and 6 member states. And lastly, on the next slide, the MAF Plus initiative on manufacturing and access to vaccines, medicines, and health products is a large initiative worth almost 2 billion euros, supporting local manufacturing and access to health products in Africa, bringing together the EU, 7 members, and the European Investment Bank, and offers financial and non-financial support to industrial development, access to finance, market shaping and demand, technology transfer, regulation, and research capacities. There are already 5 national programs supported in 5 African countries, and of course with the regional entities in Africa. And it has also developed financial instruments that can support private sector to invest in Africa. And one key instrument is on the next slide, is the HDX, the Human Development Accelerator. It's a line of credit from the European Investment Bank that is guaranteed by the European Commission and is established in partnership with the Gates Foundation to support local and European companies operating in the partner countries. It has a focus on health, but a wide scope also including nutrition. 650 million euros are earmarked for sub-Saharan Africa. The European Investment Bank can take up to 50% of the total investment, which must have at least 20 million. The recipients are private companies with a sound business model and that can repay the loan, and the investment terms is less of 12 years. So if this is of interest, please contact my colleague, Miguel Campo-Lopez, who is also on the call and will be available for questions in the Q&A session. But you can also reach him by email if you want to know more whether this instrument might be of interest to you, which on the next slide it says again that it offers venture debt, corporate loans, volume procurement and guarantees on the next slide, and it supports R&D, manufacturing, and supply chains. So with that, I'll hand back to Lara. Thank you.
Thank you, Jan. And I hope everyone found that useful background and context on the various initiatives that the European Commission is organising. Now I would like to introduce Dr. Thomas Nyarenda, who is Strategic Partnerships and Capacity Development Manager and the Head of Africa Office at the EDCTP Association, which is our second governing partner in the joint undertaking. And he's going to talk to you about the role of the EDCTP Association. Over to you, Tom. You hear me, Tom?
Hi, Laura. I don't know whether
great.
you're able to hear me. There was a bit of an interference there.
I do hear you, so hopefully everyone else does too. Please go ahead.
Thanks very much. Thanks very much, and thanks for inviting me to talk about the EDCTP Association. And the rationale is clear, really, because over and over again, colleagues who are interested in this work program will see that the EDCTP Association is featured as a major part of the work plan. And for these applications, it is really in two ways. The first one is that, especially for Africa, countries that are not part of the EDCTP Association, their institutes are ineligible to get Global Health EDCTP3 grants. And secondly, the countries that are not part of the EDCTP Association are not also being able to contribute to annual discussions on production of such work plans. So to start with, maybe the question would be, what is the EDCTP Association? So the next slide describes a little bit about what the EDCTP Association is. As you can see, it is a body that brings together African member states and European member states that have subscribed to be part and parcel of the partnership. And through its formation, this association has played three key roles. The first being the first implementing body of the EDCTP2 program that ran from 2014 to 2026. And now, as Lara mentioned, it is the founding and governing partner of the Global Health EDCTP3 with the European Union, but also forms a platform for international partnerships to advance equitable and sustainable global health research. And for us in Africa, very important, because that brings it into a level of a platform where we also have to feed into the regional strategies, for example, the Africa Union, WHO Afro, and others. If you ask me where the countries which are members are, the next slide shows that, and you see that, as Lara said, we have currently 15 European countries and 32 African countries as full members of the EDCTP Association. And we have another group of countries that we call aspirant members, which are 10, which you see on this slide. And basically, these are countries that are ongoing discussion in their own countries to make a decision how they're going to participate, which ministry should head the participation, etc., etc. The only odd one out is Switzerland, because when it comes to what I say, it's not getting EDCTP, Global Health EDCTP grants, that does not apply because they are already part of Horizon Europe. And I'll talk about that a little bit later more. So the next slide shows you how the EDCTP Association is governed in terms of where the offices are. We have a presence in Europe, and the office is in Netherlands, in The Hague, and the African office where I am is in Cape Town. The two offices have complementary roles, almost the same in terms of what they are doing for the both continents, except that when it comes to the issue of technical support, the Africa office supports the Global Health EDCTP3 program in conceptualizing capacity building activities and developments. But otherwise, everything else is the same. In Africa, we coordinate the relationship of EDCTP with other African partners on the continent, and the European office does the same for the European terrain. But our goal is really to bring Europe and Africa together, as I mentioned earlier on. Now, when it comes to the role of coordination of projects, because this is the second part where you'll see in most of the calls that the EDCTP Association can be a coordinator. And this relates specifically to two calls, and this is on the next slide. I think the next slide will talk about the two calls that in the program relates to having a possibility of the association being a coordinator. And this is based on the new organization of what we call lump sum funding. And my colleagues that are online will talk a little bit more in depth about what lump sum funding is. But you'll see that for the cause that Dr. Makanga mentioned, on enhancing integrated research and healthcare in sub-Saharan Africa through digital innovation and artificial intelligence, and the other on training networks for developing capacities in ethics, regulation, pharmacovigilance, and other related digital platforms, the EDCTP Association has an opportunity, or applicants have an opportunity, to invite the EDCTP Association to coordinate their actions. If not, the EDCTP Association can provide assistance where it is required while the applicants are putting together the applications. More of this will be shared on the 25th of February, where we have a coordination info day, and the link is in the slides, and it's also on our website for those that are interested to hear more about the coordination support, how it is organized, how we intend to move forward, and also answer questions and queries. Please register on that different link for that info day. Now, some countries that are not part of EDCTP Association may have questions on how to join the EDCTP Association and what are the benefits. So on the next slide, we describe sorry, maybe I should go back to the role of the EDCTP Association as a coordinator before I go on to the joining bit. So if you go back to the, go forward again to the next slide, please. Another one. Yeah, next one, please. That's right. So just to dig a little deeper into the coordination, in the coordination, it means that the EDCTP Association can provide technical support, as I said, and act as the main contact between the consortium and the Global Health EDCTP3 through the process of the applications. And when the consortium is successful in getting EDCTP grants, the EDCTP Association will act as the grant recipient and distributor on behalf of the consortium, but also help the scientific project leaders to submit reports to EDCTP, Global Health EDCTP3. One thing to note when forming the consortiums is that the association does not count as one of the 3 independent legal entities required for the consortium eligibility. And my colleagues will talk more about that. So let's move forward. Let's go to the now joining the association. For countries that are not part of the EDCTP Association, we give them guidance on how they can join. And also it's important to talk about the benefits before some countries can decide whether they should join or not. So as you have seen, for a country that is part of the EDCTP Association, that means the institutions can benefit by participating in Global Health EDCTP3 calls for proposals. And that also provides an opportunity for strengthening strategic engagements between those countries, institutions, between Africa and the European Union under the Global Health EDCTP3 agenda. But that also strengthens, as I mentioned, generally, the R&D ecosystem platform that the EU and the AU wants to establish, as my colleague Jan mentioned earlier. And EDCTP welcomes scientific leadership across all the continents, and we believe that scientific leadership and ownership comes from countries. So all countries that are part of the EDCTP Association will enjoy representation and voting powers when they are on the EDCTP General Assembly. And the work plan that we have seen today, or which has been talked about today, is a product of the EDCTP Association putting it into action from conceptualization to approval. So what does it take to join the EDCTP Association? I think this is on the next slide. It's a very simple process. A country needs to express interest through the ministry that is chosen by the country. And we send them the info pack to guide them through the process. And then when the letters of commitment from the country are received, we send them to the General Assembly of EDCTP that I mentioned, and they vote on the outcome. And as far as I know, not any country has been denied membership as long as they've met the minimum basic requirements. But countries need to commit to something for joining the EDCTP Association, and that is on the next slide, I think. And that is specific rules of play, one of which is to demonstrate in-kind contribution, which needs to be recorded, that they are spending resources towards the missions and objectives of EDCTP, and that's what we call in-kind additional activities. Not to bog you down with the technicalities, I think this can be, unless you have special interest, we can answer questions on that. But basically, that commitment, when it is shown, then it meets the membership requirements. The other one is the cash contributions for administrative costs, which also are different from country to country based on their GDP. So I would conclude on the next slide just to say that, as I've said, it is important, especially for African countries, that they are part of the EDCTP Association for their institutions to enjoy the applications and grants from Global Health EDCTP3. Just to mention that the eligibility for funding under these calls must be complete by the time the grants are signed. So it is possible to have a country in an application that is not yet in the EDCTP Association, as long as you're sure that you're working towards its memberships, such that by the time the grant is being signed, if your consortium is successful, which in usual terms is 6 to 8 months, the countries that are in that consortium are full members of the EDCTP Association to enjoy the full benefit. So let me stop there. Thanks, Lara. I'll be happy to take questions later.
Thank you. And I hope that was a helpful overview for you all on the role of the EDCTP Association and really how critical it is to have African countries becoming members of the association in terms of eligibility for Global Health EDCTP3 funding. So we hope that you may also play a role in reaching out to your authorities if they are not yet engaging with the association to become a member. So before I hand over to my colleagues for our next part of the agenda, I just want to welcome those of you that may have joined us a bit later than originally anticipated. You may have missed some of the opening remarks and the housekeeping. Unfortunately, we had a few technical issues with our original link for this info session, so we had to start with a different link, and that caused a bit of a delay to our program. We are trying to catch up on that, and you may have seen that there was originally a break foreseen at around 11 o'clock. We will now be skipping that break so that we can try and make up time and finish as close as possible to our original ending time as possible. I also want to just remind, I see many of you already putting questions in our Q&A section of the webinar, and to encourage you to continue to do that. Hopefully some of these questions will already be responded during the upcoming Q&A session or during the slides that will be presented by colleagues shortly. But please do continue to send any questions, and in case your question isn't addressed sufficiently in the upcoming slides, we will also come to it then in the Q&A. Please let us know if that's the case as well. And just to remind you that because we have limited time, the best way of getting your questions answered is to upvote them. So if you see a question in there that you would really like to see answered, please upvote it so that we can address those questions first in the limited time we have available. And anything we're not able to respond to today, we will respond to in writing, and this will be shared along with the recording and the slides on the event page, and we will be updating the Q&A on a weekly basis. So I'm now going to hand over to colleagues from our scientific operations team, and I'm going to now be joined on screen by Jean-Marie Vianney Habarujira, who is the Senior Scientific Officer, and Sylvia Garcia, who is the Scientific Project Officer in Global Health EDCTP3, and they will be presenting our work program 2026 calls for proposals and topics, which is probably the meat of the meeting that you're all looking forward to hearing about. So I'm going to hand over to you now, Jean-Marie. Go ahead. I think you're unmuted. Yeah.
Yes, thanks, Lara. Thanks, everyone, and good morning, good afternoon, everyone. I'm delighted to be with you today. And now, as Lara just mentioned, this is maybe the part that you've been waiting for. I will make sure to provide information that you need to know as you apply, because we've opened these call topics since the 14th of January. So some of you are already writing proposals, but you may have questions. There may be things that you are still not getting through the teams that are drafting the proposals. This is your moment to hear how we interpret this text, but also get your opportunity to ask questions during or after the presentation. If I can move to the next slide. Now, as you may have seen, this is a work program which was adopted by our governing board back in December. It has two major calls, competitive calls. One which is including the RIAs, what we call Research Innovation Actions, two, and one which is going through what we call coordination support actions. In total, there are 6 topics, but divided in what we call calls. And there are 2 which will be in 2 stages. What we've opened in January is everything, including what will go all the way until September. But we do have a set of call topics which will close next month, and probably most of you have been waiting for this day to be able to complete a set of activities that you like to describe in the proposals. Now, there's also a provision for mobilizing research funds in case of public health emergencies. We hope it will not be needed to activate that mechanism, but just in case, we do have that provision. And as you can see, this budget may increase depending on contributing partners that we are talking to. Next slide. Now, as I was mentioning, these are the calls which some of these calls maybe are not very important for you drafting the proposals, but to be sure that you've understood where to find information, we do have a work program which describes these activities. But when you log into the funding and tender portal, this how you can use this table to find the exact topic you want to apply it, because if you open call number 1 from the portal, it will give you a link to these topics that are in the second column, and then to be sure that you are applying to the correct topic, you have to make sure you've read that title, because we've seen in the past that some have thought maybe that they are applying to call topic number 1, but they ended up sending an application to 2. That creates a bit of confusion when we have to shift proposals to the right call. So this for you to be sure just to check in the funding portal that you are looking at the correct title. Next. But the first that we are going to cover today is what I may be referring to as the TB topic. This is the first. If you open the portal, where you will see that it is a global collaboration action for the development of TB drugs. of therapy and chemoprophylaxis in adults and children in sub-Saharan Africa. Next. Without repeating the title and some of the information that you are well aware of, this will be a research and innovation action, meaning that you can conduct clinical trials in this under this call. And the indicative call topic budget is 30 million. So we're looking at projects that will be in size of approximately 10 million. So if you do the math, we're looking for 3 large-scale projects which can be supported by that 30 million. As I mentioned, call deadline, first stage, we are going to close on the 4th of March. Be mindful of the time. It is Brussels time at 5 o'clock Brussels time. That is the deadline. You cannot come back and try to submit after 5. I know in the past, in some cases, there used to be deadlines that go all the way to almost midnight, but this is Brussels time, just to make sure you don't miss that deadline. If you are lucky and invited to the second stage, you'll be invited to submit a full proposal, which will be then closed on the 17th of September. But that is if you pass through this first stage. Now, in terms of expected outcomes, we do want projects that will deliver results, contributing to improved TB-related outcomes in adults and all children in sub-Saharan Africa. We do also want projects that will lead to reduced burden of MDR-TB and XDR-TB and or improved TB interventions in vulnerable populations, particularly children. If I can get the next slide, I'll talk about a little bit about the scope. These projects, as you can imagine, this is an extensive topic which is covering a lot of things if you read that title, which include therapeutics, chemoprophylaxis, adults, children. But just to be sure we understand each other with those who are writing the proposals, the scope, we're looking at projects that are in phase 1A and beyond, in terms of phases of clinical trials, trying to advance new or improved TB regimens, including shorter or improved regimens, chemoprophylaxis, and or combined interventions. Additionally, proposals that will be coming to this topic are encouraged to focus on priority populations, including women of childbearing potential and pregnant women, and particularly children, especially for assets for products in late stage development. These proposals are also encouraged to generate clinical data progressing development of new or improved treatments regimes for MDR-TB and XDR-TB. As you can see, we put MDR-TB and XDR-TB in clear, visible ink, just because we do know that some of the projects in our pipeline have been focusing on TB in general, but we do know that there's a growing issue, especially in certain pockets of sub-Saharan Africa where MDR-TB and XDR-TB are increasingly an issue of concern. These proposals are also encouraged to focus new research on pulmonary, extrapulmonary, and latent TB forms, drug resistance, of course, as I was mentioning, combination of chemoprophylaxis with the vaccines, and combination of chemoprophylaxis with the host-directed therapies. There's also an encouragement to focus on development of treatment for latent TB, and in this case, there should be a focus on individuals with increased risk of active disease progression. So if you're writing a proposal and there is a major focus on the latent TB, make sure to demonstrate, to convince our expert evaluators that the population you'll be looking at includes those who are really at risk of disease progression into active disease, because in many cases, as we know, there are millions of people living with latent TB but tend to never develop active disease. So you have to make a case that if you are developing that treatment for latent TB, it is that group that you will be looking at in terms of participant recruitment. If I can get the next slide. Again, talking about the scope, as you will read through the work program and call text, sex, gender, and age differences should be considered well relevant, especially for phase 3 studies. Those that have undergone a lot of efficacy testing should now be looking at these gender and age differences. Treatment decisions algorithms can be included, but not as primary objectives. Proposals can address co-infections or comorbidities of TB, including HIV/AIDS, but not as the primary objective of the proposal. Implementation of solutions that are ready as soon as possible. Granting authority, of course, our organization will base the funding decision on ranking of proposals considering the portfolio approach. This is to mean that if we have that set of 3 proposals to be funded under this call, we'll be very much looking at products that can be registered soon, because we do have limited funding, but also limited timelines to make sure we deliver these products to the market that will distribute them to the population. So this portfolio approach will be guiding our decision when we see what has to be funded. Now, you may have seen that these slides include the logo of the Leprosy Research Initiative. This is because this core topic, in terms of post-exposure prophylaxis research, there's also a focus, and it's eligible if you include leprosy. But in this case, you should be informed that some of those projects that will include a leprosy focus, there will be co-funding coming from our partners, from our partner, the Leprosy Research Initiative, registered in the Netherlands. In this case, we do know that there are some countries in Sub-Saharan Africa that are more confronting the leprosy questions more than others. So if your consortium is including some of those regions, you should be aware that this partner will be co-supporting this work. And in the past, of course, research leprosy was not necessarily coming up in our portfolio a lot, but this call will allow us to support leprosy work as well. Next slide. Now, this is just to make sure we understand each other when we do work which is in between TB research and other diseases, just to be sure that you are not going to be told that your work was not eligible based on being in or out of scope. It's been highlighted in the call text that development of prophylactic vaccines, diagnostics, and monoclonal antibodies, phase 1A/B clinical trials of single and or combination drugs, implementation research, which may be in early phases, preclinical studies, all these will not be in the scope of this call. They will be out of the scope. Now, we put there down that information related to all these core topics can be also found in the Strategic Research Innovation Agenda. This is to mean maybe it relates to all the topics where you may be having a confusion on what is in the scope of our organization when we would support disease or interventions. If you read our SRIA, Strategic Research Innovation Agenda, you'll be able to understand why, for example, we do not support preclinical studies, why we do not support certain diseases. That's the document which maybe is the base for everyone who wants to know what is in our scope. Now, expected impact, contribution to achieving the reduction of disease burden in Sub-Saharan Africa through increased international cooperation among researchers and funders, catalyzing research synergies, and leveraging resources and investments. Proposals are expected to include in-kind and financial contribution from what we call our contributing partners in order to produce more meaningful and significant effects, enhancing the impact of the rest of the research activity. So as you know, this topic would be in 2 stages. In the second stage, that's where, as it is a global collaboration action, you'll be invited to submit the letters of endorsement for the partners that are going to support your project, in addition to the funding that you'll be requesting from our budget. Next slide. Now, what is the second topic is what we are going to be referring to as the lower respiratory tract infection topic. It is also a global collaboration action, which means you will be invited to provide proof that you'll be supported by other funders who will put money on top of what you request from our organization. This is for prevention and treatment of lower respiratory tract infections in Sub-Saharan Africa, of diseases that are in the scope of our organization. Next slide. Now, expected outcomes include delivering results directed, tailored towards and contributing to strengthening the capacity of Sub-Saharan African health actors to address lower respiratory tract infections, their associated complications and barriers to effective management. This includes improving lower respiratory tract infections related outcomes, including mortality and morbidity, or increase access to lower respiratory tract infections in interventions in Sub-Saharan Africa. I did not go back to that reading of the budget, but as you can see, here we are expecting to support about 4 projects with the budget we have. And in the brackets, you can see the budget, which can give you an idea of what we are looking for. It is because if you read the title, If we talk about prevention and treatment, these may be slightly a bit more expensive projects, which in case you include some of the prevention methods, which if we still conducting efficacy studies may prove to be expensive. Deadlines are the same as the previous topic. And we're looking at projects which will allow us to advance prevention and treatment of pathogens related to lower respiratory tract infections by evaluating almost everything: safety, immunogenicity, efficacy, and the effectiveness of approved or novel preventive or therapeutic candidates. Next slide. In terms of scope, we'll look at projects which will allow us to support late-stage clinical studies. So this is to mean phase 2B and after, advancing prevention and treatment of lower respiratory tract infections pathogens. As you can see there in that box, we've put a list of pathogens in the scope of this topic. So make sure you go through that list to ensure that when you bring your proposal, our expert evaluators will not declare it out of scope. It is important because these can vary from country to country, where some countries maybe are experiencing more influenza than others, where you have maybe RSV being a national issue. When you draft a proposal with other partners, make sure to check this list to stay in scope. Now, at least one of the following points should be addressed. One of the 2 bullet points: obtaining evidence of immunogenicity, efficacy, safety, or clinical utility on new or existing preventive measures against lower respiratory tract infections pathogens, or obtain evidence of efficacy, safety, or clinical utility on new or improved existing treatment measures against these pathogens. So it's one or the other, well, at least prevention or at least treatment. Next slide. Further, I think I lost connection for a second. At least one of these bullet points should be included: obtaining evidence on new or existing preventive health solutions against lower respiratory tract infections for children, including maternal vaccination. I insist again, it's at least one of these 4. Improvement of preventive and of treatment measures, coverage, access, scaling up, and or availability, or implementation of existing intervention with demonstrated efficacy and safety in other regions, with generation of data on real-world effectiveness and cost effectiveness. Some of you may be working on RSV, for example, in Europe, but you may have partners in Sub-Saharan Africa, and you'd like to implement research based on data from a country that is well advanced in terms of RSV work. That can be included as part of that bullet point number 3. Generation of clinical data on host strengthening interventions, for example, non-specific effects of live attenuated vaccines, probiotics, and or other non-pharmaceutical interventions. Now, what is out of scope under this call? Development of antibiotics, diagnostics, any research on TB, any research on cytomegalovirus, or any other research on human coronaviruses and fungi, or any preclinical study is out of scope. Next slide. Now we're going to talk about the 3rd topic, which is on HIV. Again, it's a global collaboration action, which will involve co-funding towards a better prevention, treatment, and clinical management of HIV co-infections and all comorbidities in Sub-Saharan Africa. Next slide. You can see the deadlines are the same. For the first stage, 4th of March, we at 5 Brussels time will close the call. The first stage is again a research innovation action where you can conduct clinical studies, clinical trials. Budget's 25. We're looking at 5 projects almost in the area of 5 million per project. These outcomes listed here all are required. This is important for you drafting the proposals under this topic on HIV. All these 4 bullet points are required. So we look at projects that will help us improve prevention and or treatment outcomes for HIV-related co-infections or comorbidities, better integration of healthcare services and support programs related to HIV co-infections or comorbidities for people living with HIV, improved clinical management of people living with HIV and related co-infections or comorbidities, particularly safer and more effective polypharmacy, as this we know is an issue in countries, especially in the context of shortages of antiretrovirals, but also evidence supporting better informed policy making and guidelines updates for HIV-related co-infections and comorbidities. Next slide. Now, I've seen that some of you have been posting questions related to this issue of co-infection comorbidities. Make sure you read this call text very well, because some of these things are maybe clearer when you read the whole document, to be sure you are not missing the most important information. In terms of scope, late-stage clinical studies are what we are looking at. Again, it's from phase 2B or later, generating evidence on efficacy, immunogenicity, safety, and or clinical utility of novel improved products that aim to prevent, treat co-infections or comorbidity in HIV patients in sub-Saharan Africa. This is to include prevention of HIV comorbidity development or HIV disease advancement, or effective service integration in healthcare systems, including, again, safer polypharmacy use. It's also generation of evidence to support public health decision-making. Here we are talking about some of the policies which may be in need for updates, cost effectiveness and implementation research, especially for new innovations such as long-acting injectables or monoclonal antibodies. Here under this last bullet point is where we want proposals to clearly demonstrate how they'll address the issue of affordability and accessibility of these new innovations. What is out of scope? Surveillance studies with new cohorts, or studies focusing on development or evaluation of diagnostics, any preclinical study, intervention focusing only on HIV prevention or treatment without addressing any co-infection or comorbidities, those would be out of scope. So you read carefully what is in that target population box, just to make sure we understand each other when we talk about some of these association with the comorbidities, or when we talk about inclusion of in patients with impaired organ function, which under this call we see as the vulnerable subpopulation if we look at the overall population living with HIV. So when we look at people with the impaired organ function, it should be clearly demonstrated in the proposal that you're looking at that specific category when you come to recruitment. Next slide. Now I'm transitioning to the fourth topic, which is also a global collaboration action involving co-funding from partners who may be putting money on top of what you are requesting from our budget. It is on climate and health in sub-Saharan Africa. Next slide. Again, deadline is the same. 4th of March, we are going to close at 5 Brussels time. It's a research innovation action, so you can conduct clinical trials under this call. We're also looking at a set of almost 5 projects in the area. Budget is about 5 million. I repeat these figures because it's always a good line to have when you are thinking about what to include in your projects in terms of the number of diseases to address, or types of work packages, size of the study. In terms of expected outcomes, these projects should be helping us to improve health outcomes related to climate-sensitive vector and waterborne diseases in sub-Saharan Africa, with a high and rising burden, and Europe, where these diseases may be with a rapid emerging endemic risk. But also to enhance evidence-based decision-making related to mitigating the impact of climate change on the health of populations of Sub-Saharan Africa, but also increased engagement of communities and primary healthcare systems in lowering the burden of climate-sensitive vector and waterborne diseases. Next slide. Now, this is a busy slide which will take a little bit of time to explain. This is the scope. When we talk about scope, this is important for everyone to know. We do have our experts who can declare a proposal to be in or out of scope. And when it is out of scope, you understand that it leads to rejection. So it is important to read when we put these a few lines in the call text where we say minimum of the following should be included. So the first one, minimum to be included in the proposal that you'll submit to make sure it is eligible, it is in scope. Clinical trials, phase 2B or 3, or post-authorization effectiveness trials, which can be phase 4, developing a preventive or therapeutic product or vaccine against a climate-sensitive pathogen in the scope of our organization, or a large-scale implementation research addressing a climate sensitive vector or waterborne disease, and integration of climate, environmental, and health system data. It's a lot of text, but make sure to read this to capture at least the left or the right box to be sure you are in scope. That is a minimum to have in these proposals. In addition to that, once you have that first bullet point, in addition of the above, all of the following apply: integration of One Health aspect into research. Here is the crossover between human, environmental, and animal health. You can check EU guidelines on what we're looking at when we incorporate One Health concepts in the research we support, encompassing primary healthcare systems, community health workers, and the community into your study. Of course, inclusion of underserved and vulnerable populations. Here, we again insisting on children under 5, pregnant women, elderly, and people living with different comorbidities. Next slide. Again, on the scope, this is on top of what I was mentioning in the previous slide. At least 2 of the following bullet points should be included. At least 2. Inclusion of indigenous population as defined per national regional context. When we talk about indigenous population, it can vary from a context that maybe is very specific to Namibia and a context which is very specific to Ethiopia. I'm just mentioning these 2, which are very different from each other. But if you go there and say indigenous population, it means different things. So make sure to base your proposal on the national or regional context when you want to address climate and health in these pockets where you have indigenous populations who are in some cases neglected or at least not always included in research. Study the impact of climate change on supply chains and access to medical countermeasures. Involve local, regional, or national health and climate authorities, policymakers, bridging the gap between research and policy making, but also integration of research in national adaptation plans and national health emergency plans where they exist or are about to be put in place, including adaptations of primary healthcare systems to climate change, for example, infrastructural improvements or training of primary healthcare workforce. What is out of scope under this call? Of course, after mentioning all these bullet points which are to be included or not, out of scope, it's climate or environmental research without clear health or disease outcomes, studies not addressing vector or waterborne diseases. So it's important to see what is the disease you are trying to address, and it's important to make sure it is not just adaptation or addressing the climate problem, but also there is a health component, a disease component that you're addressing. Next slide. Now from here, I'll hand over to my colleague Sylvia, who will talk about the calls and on the coordination support actions under this work program. Sylvia.
Thank you, Jean-Marie. And good morning, good afternoon, everyone. Indeed, I will be speaking about the coordination and support actions. Those ones are single stage, so differently than the RIAs. So you will be preparing and submitting the full proposal at once, and the deadline is 2nd of September. So don't confuse with the second stage of the RIAs that is 17th of September. Then also the 2 CSAs that I'm presenting today, they have the lump sum model funding that we will have at the end of the day today, a presentation specific on this model. So the first one is abbreviated as SERP, and it's training networks for sustained capacity building related for ethics, regulatory, and pharmacovigilance. Next slide, please. So the topic budget that has been published for this topic, it's 15 million euros, and this would enable to support around 10 projects. But I'm very happy and pleased to inform you today that we have received a letter of endorsement of one contributing partner. So this is CEPI. And this letter is currently subject to the approval of our governing board at this moment. And once this will be confirmed, the budget will be changing, and this may enable to support additional projects for this call. So as expected outcomes for this call, we have the strengthened regulatory and research ethics oversight capacity for both national and regional authorities in the sub-Saharan Africa in order to enable to operate with WHO maturity level 3. And this is for 3 components. So it's for clinical trials, for registration, marketing authorization, and or pharmacovigilance for both medical products, therapeutics, and vaccines. The proposals that you will be submitting should achieve at least 2 of the following outcomes. So improve the digital infrastructure for the assessment of clinical trials by the Research Ethics Committee and regulatory authorities in the region. And this will need to include the use of new digital technologies. So for example, artificial intelligence and big data. Secondly, to accelerate the use of digital tools and the data analytics for real-time safety data monitoring. So pharmacovigilance reporting and pharmacovigilance data sharing across different countries and globally. To improve the coordination of multi-center trial reviews through harmonization and streamlined research ethics processes. Also to strengthen the alignment and cooperation across the different countries, and this is for the 3 components as well, ethics, regulatory, and pharmacovigilance, and in line with global standards. And last but not least, to enhance the preparedness for public health emergencies through the acceleration and harmonization of authorization of processes. Next slide, please. In the scope of this call, we have to provide scientific advice and to build knowledge on the assessment of innovative clinical trial applications and or marketing authorizations and pharmacovigilance functions. And this is for both, for ethics committee and or regulatory agencies. It might be the case that these have not reached the maturity level 3, but then we will give the opportunity that they benefit from other partners in the consortium that they have reached maturity level 3 or 4. As the second scope of this topic call is to establish and reinforce the training and twinning networks or potentially of the regional regulatory authorities dedicated to the training of ethicists and regulators. What is out of the scope of this call is any capacity building activities related to manufacturing for both pharmaceutical and vaccines. So examples of this is including, but not limited to, the byte release, to support for the local manufacturing of active pharmaceutical ingredients, the technology transfers, the diagnostic production, any financing or any policy strategy supporting in manufacturing in general. But please note that what is in scope, it will be reinforcing or enhancing the national regulatory authorities' capacity to conduct inspections around manufacturing to enable registration and marketing authorization of medical products. Next slide, please. Additionally, the proposals are expected that address or achieve at least one of the following statements or components: building national and or regional continental ethics and regulatory capacity for the use of digital technologies. And this is for the improvement and of the review of the clinical trial applications and or marketing authorizations of the medical products. Also to improve the integration of pharmacovigilance system into national health systems by the use of the digital reporting mechanism and data sharing across the different countries and in alignment with the international guidelines. This can be achieved in 3 ways, but this can be complementary at the same time. So the implementation of collaborative digital platforms in order to accelerate the use of digital reporting. So for example, when we use the joint reviews, and also to enhance or to increase the data sharing of adverse drug reactions from the site to national systems and beyond. So the second component is to improve safety reporting, and this is in 2 ways. So to increase or improve the quality of the event of the reports of the adverse events, and also to expand the geographical coverage. And And the third or component that it can be achieved is to strengthen the pre and post authorization pharmacovigilance systems, and this would include robust risk-benefit analysis. And last but not least, so the scope of this call is also to improve regulatory and ethics frameworks and the preparedness for public health emergencies infrastructure, and this can be achieved through harmonization of processes, regulatory reliance, or the use and implementation of digital platforms for example, for the joint reviews. So in a nutshell, the aim is to move towards a more global and harmonized regulatory approach in order to support the authorization of different products in different or the same products, sorry, in different jurisdictions. So with that, I'm pleased to welcome today one of the CEPI representatives that will be talking more about their support to this topic call. So we have at the call today Dr. Jochen Overbach. He is the head of regulatory affairs EMEA, so Europe, Middle East, and Africa. So the floor is yours, Jochen, and welcome to the call.
Thank you so much, Silvia and EDCTP team, for giving me the opportunity to provide a brief insight into CEPI's interest in this fantastic program. So CEPI engaged with EDCTP to co-fund the call for training networks and sustained capacity building related to ethics and regulatory pharmacovigilance, because strengthening regulatory ethics and pharmacovigilance systems is really essential to advancing clinical research governance, accelerating vaccine and medical countermeasure developments, their deployment, and thereby improving pandemic preparedness, which is important for CEPI, of course. This can be achieved by projects on vaccine-specific knowledge building, implementation and novel digital platform support, and by having always the safety oversight in mind. Our letter of endorsement of CEPI's contribution to the call has been sent to EDCTP, as Silvia mentioned already. We submitted it end of January, and this will allow for more projects to be awarded and conducted. And we hope to see applications on projects that advance or build coordinated networking, twinning, digitalization, and build foundational and experience-based knowledge. Such projects could be on strengthening joint reviews, scientific advice procedures. We would like to see advancement and expansion of the AVRF digital collaboration platform, which has been implemented recently. We would like to see really strengthening the ethics networks across Africa, and these networks could work on continental harmonization of ethics framework. We have the following questions there in mind. Is continental harmonization possible? Can there be parallel ethics and regulatory reviews by default? Can there be single combined reviews by national ethics committees and IRBs, the institutional review boards, instead of separate reviews? Which role should ethics reviews by institutions outside of Africa play? And can continental guidelines be written for implementation by countries in a harmonized way? Further than that, implementation of regulatory and ethics twinning partnerships and network programs would really be something where we would like to see applications. And there is also a need for a continental consolidated learning ecosystem hub. A structured and standardized training program is really needed for the continent. And we are convinced that such projects will be contributing to preparedness for epidemic and pandemic threats. But please be aware that matching the specific CEPI interest in emergency preparedness are not to be seen as a competitive advantage over other projects. All topics are equally important, and please make your case for whatever you feel is important to Sub-Saharan Africa. Thank you so much, and looking forward to your applications, which will be evaluated by independent committees. Back to you, Silvia. Thank you.
Thank you, Jochen. And And thanks for participating today, and thanks to CEPI also for supporting this topic call. I think in our views, this is a very important partnership for our applicants, and this is also supporting or continuing the work that EDCTP work program already initiated with increasing capability on ethics and regulatory. And we are also very pleased to bring, and as you mentioned, 2 additional components, so the pharmacovigilance and the preparedness for emergency public health. So, but also, I mean, to reiterate what you say, it's a very extensive topic. There are many components to cover, but they are equally important. So we expect to, yes, that to cover one of the 3 components or more than one component, and we expect to receive quite a lot of applications. So it will be quite competitive process, but we are very pleased to have this call. So next slide, please. So with that, I will be moving to the second coordination and support action for today. So afterwards, my colleague Jean-Marie will be speaking about the third one. And as I mentioned before, this one is also lump sum model approach funding, and as well as single stage with a deadline on 2nd of September. Differently than the RIAs. So the topic is enhancing integrated research and healthcare in sub-Saharan Africa through digital innovation and artificial intelligence. This topic, the indicative topic budget is 18 million euros, and this is to enable to support around 8 projects. As the proposals will need to achieve at least 2 of the following expected outcomes. So to expand the implementation of validated digital innovations at national or sub-regional level, to improve the data interoperability of the electronic health record system between different digital health systems. So that means what we want is to improve the virtual moving of the data, so the access and the sharing of this data between the different digital health systems, and according, of course, to international standards. To build a sustainable roadmap for the use of digital health tools and be transferred in the best way possible to clinical trials and public health systems in the region. And last but not least, to increase the retention of skilled experts in digital health, epidemiology, bioinformatics, and artificial intelligence. Next slide, please. As a scope for this call, we have the aim to strengthen the health systems in order to enhance the development and the use of existing and new digital health records and tools. So that is including, but not limited to, artificial intelligence and machine learning. And the aim is to use this for the prevention, for the diagnosis, and for the treatment of infection diseases in the region, and to enable that this is translated in policy strategies for healthcare workers and also for policymakers to help them in their decision making. Expanding the existing validated digital technologies into national and regional strategies. And thirdly, to improve the coordination between stakeholders, promoting or through the use of collaborative platforms, and in order to help facilitate the sharing of the data. Additionally, the proposals should be considering to add, so including data privacy and ownership data strategies. And this is specifically important for the countries with different capacity and knowledge as well, to enable to achieve societal impact, including and not forgetting the ethics requirements on the involved countries in the sub-Saharan Africa region. Next slide, please. Also to enable that the artificial intelligence tools and systems that you are proposing are fair and robust, and that the project is sustainable beyond the ending of this project. So when the funding is finished. ensuring equity across the different countries in the region, and not forgetting to include activities for capacity building that will lead to digital transformation, and enabling that these digital tools are accessible and affordable for the end users. And last but not least, engaging the communities and the relevant stakeholders that are the key or the crucial players for this topic call. So in a nutshell, the aim of this call is to update the existing digital technologies. So the focus will be rather better on digital technologies that are already robust instead of reinventing the wheel, and rather to explore new technologies when possible. And this is to achieve societal impact and also to facilitate and help the patient and healthcare outcomes. Thank you. I think that's my last slide, and I will hand it over to you, Jean-Marie, to continue with the rest of coordination and support actions for today.
Thanks, Olivia. So what we just went through are what we call competitive calls, but we do have also, as we may have seen in our work program, other actions that are not subject to competitive calls. I'll just mention this one because it's relevant to some of you who are in this field to know. This is what we call grants to identified beneficiaries. In this case, it's about the expansion and consolidation of the EDCTP Knowledge Hub, which is, I'm sure, used by many of you for various search for resources. Now, this it will be given to the UN Ops implementing structure of the Global Health Network as an identified partner to expand and consolidate that EDCTP Knowledge Hub, building on over a decade of impactful collaboration with EDCTP programs, EDCTP 1 and 2. We know that TGHN has provided a robust digital platform and a vast globally connected community that uniquely delivers capacity building, and also has been a key player in sharing knowledge across the globe, not only in Sub-Saharan Africa. The proposed scope of the work, which will be done under these topics, to support 5 priorities that have been identified in our own program logic, adding these interventions, which will also be helping our organization in terms of contribute to what the WHO has been encouraging, what many of you may know as the WHO Global Action Plan for Clinical Trial Ecosystem Strengthening. Of course, this work of the WHO is global, but under this funding of 1 million, we are looking at being a key player in implementing these recommendations that we get from WHO, but in this case, focusing on Sub-Saharan Africa. And of course, not forgetting that as much as we focus on Sub-Saharan Africa, this resource, the Global Health Network, has been working across the globe. So it's really about knowledge sharing, where our researchers based on the continent will be able to tap into knowledge being shared by colleagues from everywhere on the planet. Next slide. The other one, though it is here called not subject to calls for proposals, if it happens, it will be a competition, but does not follow the route of the other topics we're mentioning. This in case of a public health emergency. As you know, for example, in 2024, there was an outbreak of mpox, and we were able to mobilize funding to support this work. Now, it's also here, it can be a research innovation action or a collaboration support action, and here proposals are supposed to create a pathway to contribute to one of several impacts that have been listed in the work program, but in this particular case, to respond to outbreaks. So you do see those 3 bullet points when we can activate this mechanism. It is in case of a public health emergency, such as the public health emergency of international concern, which sometimes get declared by the WHO, the previous ones being mpox, or we had also the largest being coronavirus, where we did activate such mechanism in the previous programs. It can also be a public health emergency under EU regulation, or a public health emergency under applicable national frameworks and regulations. Next slide. Important for you all online to know that next year, as my colleague Lara was mentioning, we'll have our forum in Madrid, our 2027 EDCTP forum. As you know, we always have these prizes that are awarded to recognize individuals and institutions that exemplify the vision of the Global Health EDCTP3 program through innovation, leadership, and a deep commitment to capacity building, and by fostering equitable partnerships and delivering high impact research in poverty-related diseases. So these 7 prizes that have been listed, I think I'm counting 6, but there should be 7. I'm not sure which one has been cut from the list. So there is a Research Team Prize, Female Scientist, Leadership Prize for European Women, Leadership Prize for Sub-Saharan African Women, Leadership Prize for Sub-Saharan African Men, and Leadership Prize for European Men. And I think I'm missing the Pascal Makumbi Prize, which is the oldest and the most known by some of you. So eligible individuals and teams encouraged to apply. All of you can look at where you are eligible and apply. This calls for application to submit your request. It's almost an application as you fill your template to apply for funding. You can also find these applications platforms on our funding and tender portal, and this will be open in the coming few months. You'll see the announcement via our website and on our social media. These applications, as I mentioned, will be via what you know as the EU funding and tender portal, and the prizes will be awarded in Madrid in April 27. And just to mention that when we share these slides, we'll make sure to add the missing Pascal Makumbi Prize. Next slide. I think this was probably the last. Yeah, we've come to what we call the Q&A session, and I'll hand over to my colleague Lara to mention what is going to happen and how. Thank you. You are muted, Lara.
Thank you. Thanks to Jean-Marie and Sylvia for presenting all the calls for proposals in Work Programme 2026. And I hope that has been helpful for maybe clarifying some parts that were not so clear for some of you. I see that there's been a lot of questions coming in, which is great. So thank you very much for your active participation and your interest. We're going to bring some colleagues up on screen now to join us for the next 20 to 30 minutes. We are running a little bit behind time, so we may shorten the Q&A a little bit for now because we have 2 further Q&A sections later in the programme. And we're going to start, as I mentioned earlier, with the most upvoted questions. So this is just a reminder to upvote those that you want to be answered the most, because we have limited time, and we'll work in the order of what you find most important to be addressed. So when I look now, 1 second, I'm just checking, refreshing. There was one question that has been very much upvoted. It seems to be the most popular question here. It has been addressed by colleagues, but maybe just for clarity and to have a definitive answer, there is some confusion in terms of the template that should be used for proposals for submitting in the system for the first stage of the calls, as there was notice that the template was referring to 2024. So the question is whether the template should be used that's in the submission platform. And colleagues here have confirmed that, but maybe Jean-Marie, you want to just give some final guidance on that so that everyone is clear.
Yeah, I see that colleagues have indeed replied, and we will check what the discrepancies are, but make sure to use what you find in the funding and tender portal, because that's the only template you can submit. You cannot download something outside that portal and bring it into the submission system. But we'll see if there is a correction that has to be made somewhere. But use what you are able to find in the funding and tender portal.
Great, thank you, Jean-Marie. So we have a lot of questions that have been upvoted that relate to co-funding, contributing partners, There is a section coming after this Q&A that will be specifically talking to some of these elements. So we'll focus first on some of the questions that relate specifically to the calls. And if we have time, we may come to some of the other questions. But hopefully a lot of them will be addressed in the coming presentations as well. There's a question around the number of proposals that typically advance from first stage to the second stage. Is it usually 2 or 3 times the number of proposals that we funded in the second stage? Colleagues have pointed to our annual activity report that was published on the 2024 calls, where you can see in table 5 the success rates at the different stages. I don't know whether Jean-Marie or Sylvia, you wanted to make any additional comment around this in terms of general trends or any specific comment you wanted to add on this. Otherwise, we take it that this the activity report provides sufficient data for people.
Yeah, I think the only thing to add is if you look at that budget we have, we cannot predict, but if you look at the budget we have, if it is 30 million indicative topic budget, we tend to invite proposals which are worth 3 times the value of the budget. And that is dictated by the scores. So if you have a score which is above threshold, meaning first stage, you have to have at least 4 on excellence, 4 on impact. It moves to second stage, but it depends on, of course, if we have hundreds of proposals, we end up looking at what we call the dynamic threshold. So if that dynamic threshold means we try to be as close as possible to a set of proposals that are worth 3 times the available budget, so that in the end you have almost to make sure the chance to pass through the final list is close to 1/3. So what we have in the pot in the second stage is almost 3 times what we are going to invite. But that is dictated by the number of you who will respond to a call. And sometimes we can move that score to 9.5 out of 10. If you have 8 out of 10, it's not a given that will be invited. So that dynamic threshold can move depending on what we have. But it's 3 times the available budget.
Right. Then we have a question around the consortia and whether they have to be finalized at stage 1. Is it possible to onboard additional partners after stage 1? And what about industry partners for in-kind contributions? So colleagues have directed this question comes from Michael Edelstein. Thank you for joining us. Colleagues have directed Michael to the Q&A, but is there anything that you wanted to specifically respond to on this, Sylvia or Jean-Marie?
Yeah,
I can reply to this one if you want. Jean-Marie, you complement. So yes, after stage 1, the consortium composition may change, but I take the opportunity to mention that you really need to comply with the consortium composition criteria that we have. There will be a presentation afterwards from our legal colleagues that they will be presenting the minimum 3 legal entities and where they have to be placed. So if you change it, that this is kept in mind, so that you are not dropping out then from one stage to the other. This is what I would say. And Jean-Marie, I don't know if you want to add anything else.
No, that's clear.
Thanks, guys. So there's also related to consortia a question about whether sub-applicants can join multiple consortia and therefore be part of multiple applications. It's clarified in the response that the only requirement is that the applicant fulfills the eligibility criteria stated in the work program. But then a subsequent question, and these questions come from Jane Murray and Florian Steiner, thank you, are asking whether this also applies under the same CSA, so even as a consortium member or as a coordinator. Any immediate response on that? Do you want me to repeat the question?
Yeah, please. I think I lost the audio.
So it's whether sub-applicants can join multiple consortia and be part of multiple applications.
Okay, I guess I was confused about the term sub-applicants. Maybe we'll just see as a co-applicant. Let's say an institution can be in more than one proposal. You are not limited to just one. In fact, almost everyone does it depending on the number of calls we have. So there's no limitation. You can be, you can respond to more than one call.
Sylvia, there's a question here for you on the digital call from Joe Schott. Thank you for joining us. Asking, how are you defining validated digital innovations?
Thanks for the question. I think it's a very good question. So for this one, I would prefer that we have a discussion internally and we can get back to this so that I don't say anything wrongly for that answer. Thank you.
That's okay. Just to add, maybe Joe, if you're looking for a definition, there will not be a clear definition, but the most important is for the applicant to convince our expert evaluators that the innovation is validated by providing the proof for how and when and where it was validated. But a clear definition here, because these are innovations which we are not aware of all of those innovations which will come in the proposals. So it's up to the applicants to make a case here. But it's up to you to convince then our expert evaluators. But as Sylvia mentions, we'll make sure to provide clarification in the published Q&A.
We have a question around the EDCTP Association and whether it's mandatory that the association acts as a coordinator, or can any partner of the consortium be the coordinator? So I don't know whether Jean-Marie or Sylvia or Tom would like to respond to that one.
Yeah, maybe I can let Tom first come in and we can comment if needed. Tom?
No, I think you go first because it's more of an eligibility question, I think.
Yeah, so the maybe the person who's asking this question may have seen the last year that we have these two topics where first stage you had to have a EDCTP association as a partner and as a coordinator. And then another topic where we had to involve the EDCTP association as coordinator at the second stage. But now it is optional. If you want, you can involve Tom and colleagues as your partner or coordinator. It's up to you. But in that eligibility check, if you decided to not involve them at your first stage, you still have to make sure you have a composition that will make you eligible to pass to the second stage. And we are not going to assume that you'll be joined by the EDCTP association. It's up to you to mention that you'll invite them later or not. But for the eligibility, you already have to have an eligible consortium before getting in touch with Tom, if you want to include them, but it's not mandatory. Tom?
Yeah, thanks very much, Jean-Marie. And in case the question wants to complicate issues by saying, if you have a proposal where there's an EDCTP association and a scientific project leader, can you swap the roles around? I think that's not allowed at the moment, right? So we have to clarify that. If you decide to take the association as a partner, they come in as a coordinator. So we cannot go in just as a co-applicant. That's what I think need also to be clarified. So we can't swap the roles around at a later stage and say, because we are together, and then the association now becomes just a co-applicant, and then another institution becomes a coordinator. But thanks for that.
Thanks, Tom, Jean-Marie. So we have another question on, I believe this is the digital call, digit 02. Is the focus only on infectious diseases, or can non-communicable diseases or other health states be the focus of the application?
So, yeah.
Yes, so the question, Lara, is if it's infection diseases only or non-communicable diseases. I mean, the focus is the scope of our program, so it's infection diseases. What we need to discuss internally is in the case of co-infections, I mean comorbidities, for example. I don't know if Jean-Marie, you want to comment on that?
No, I wanted to mention that the focus, if you decide to include a disease focus in your proposal, there have to be a focus on a disease which is in our scope. But some of this research may, of course, it's a coordination support action. Some of the work may involve, for example, training of strengthening of healthcare systems in the digital context, and they can be addressing also non-communicable diseases. But if you mention only non-communicable diseases, then you risk of having a proposal which is out of scope. So there have to be a foundation on that proposal, the infectious disease in our scope. But it's a topic which will involve a lot of capacity building work that is not necessarily disease focused. And if you do disease focused, then make sure it is an ID in our scope.
Yeah, thank you. The next question is around whether it's needed to have letters of support from partners of the consortium for the first stage submission. Additionally, and sorry, this question is from an anonymous participant, whether all countries in a consortium need to submit their PIC codes, these PICs. So, Sylvia or Jean-Marie?
Yeah, maybe starting from the end, the countries do not submit their PIC numbers. Institutions register and they get a PIC number and get validated based on the data they submitted to other EC institutions who are in charge of validating the entities that can receive funding that are legally registered in the countries we work with. So it's not a country which is an institution. And at this stage, when you are applying, of course, you enter the data of your entity, but this information, this issue of PIC numbers becomes relevant when we are signing the grant agreement. So you may get requested to submit data to complete your registration. For example, if there is no validated bank details of your institution, but that is at the grant agreement signature, not at this point. Laura, I'm trying to remember what was the first part of the question.
The first part of the question is whether they need letters of support from partners of the consortium for the first stage submission.
No, for first stage submission, we don't need letters of endorsement, as we call them. But it's always good to mention that if you say I'm applying for 10 million for this project, it is worth mentioning that if invited to second stage, you intend to involve co-funding from a number of partners that maybe are already identifiable or not. So for the sake of being complete, it is good to mention that, but you don't have to send that letter of intent, a letter of endorsement at first stage.
So just, I know that there are some, for participants on the line, I know that there are some more upvoted questions related to co-funding, but I'm just trying to cover first the core-related questions because we have a section coming up on co-funding and we only have a few more minutes, so we'll just try and at least first address some of these core-related questions. The next one is on related to the global collaboration action towards better prevention, treatment and clinical management of HIV co-infections or comorbidities in Sub-Saharan Africa. For this call is writing a proposal covering one country. I think what they mean here, sorry, this is a question from Kate Kabajasi. She's asking whether writing a proposal covering one country would be eligible, I think is what she means here.
Yeah, if you describe a study which will be conducted in one country, it is fine, but eligibility is the composition of the team that will do the work. That composition has to include multiple countries from Sub-Saharan Africa, members of the association, but also from the EU or associated tourism Europe. So the composition of the consortium is different from the number of countries where you'll conduct the research in the end. It can be in one country, but the teams have to be multi-country.
Jean-Marie. There's quite a long question here from an anonymous participant relating to HIV. I'm not sure whether this is going to be a challenging one to try and respond to during this live Q&A. It may be better to respond to it in writing afterwards. The question is whether, well, someone has a project that they're planning to submit that seeks to treat lymphoma as an HIV comorbidity and to directly target HIV with dual CAR T cell therapy. I think this is too long to respond to now. It's perhaps a bit too specific. Thank you for this question. We will respond to it in writing afterwards, and then this can be shared as part of the Q&A. I think we'll take one last question, and then we'll move on to the next set of presentations. And this one is it starts to relate to the co-funding questions. The question is, if you get some level of co-funding, but do not reach an equal or greater amount to the one requested to EDCTP, will it be penalized at the stage 2 evaluation?
So we don't look at this in context of penalizing, but it is in the context of awarding. So if you have an equal amount, an amount equal to what you request, equal or greater in the second stage, you are demonstrating better impact and better quality for implementation than others. So in that context, your leveraged co-funding, if it's equal or greater, there is an award linked to that in terms of scores. And we make sure our experts evaluating the proposals understand that you don't get penalized because you are promising less than you are requesting, but you get rewarded if you are bringing equal or greater than what you are requesting.
Marie. So we'll now we'll conclude this first Q&A. Thanks very much to the colleagues that have already responded to these questions. There are a lot of more questions, but I think you're probably going to find that a lot of these get answered in this next set of presentations. If not, please mention it in the Q&A so that we make sure we come back to them, or continue to upvote so that then we know it's still a very popular question, and then we'll come back to it at the next Q&A section of the agenda. So thanks, colleagues. We're now going to take you off the screen and bring on our colleagues that are going to deal with the financial legal matters and contributing partners. As I mentioned, we originally had a break planned for now, but as we unfortunately had to start a little bit later due to some technical issues, we're going to skip the break to make up some time. So I'm now joined by Vincent de Clafet, who's our Head of Finance and Administration at Global Health EDCTP3. He will shortly be joined by Laurent Schell, who's the Legal Officer, and Augusta Martin, who's our Strategic Partnerships Officer. And they will be presenting now on the financial legal matters, contributing partners. And I hand over to you, Vincent.
Thank you, Laura. Good morning, everybody. My contribution will be very short because I will introduce my two main colleagues. In particular, Laurent will start, and then after Augustine. Here is just a short introduction to just explain you that we have prepared this set of slides about legal financial matters and contributing partners based on the lessons learned from our previous calls. Because the last call, we integrated just the collaboration actions, and we have had some lessons learned, and this set of slides is expected to provide this clarification that you all expect. So, for instance, one of the elements that we will discuss clearly was already discussed before. I didn't want to intervene because this will be part of the Q&A as we discussed previously with Lara. It's about the consortia composition and the clarity of eligibility, and in particular between stage 1 and stage 2. So Laurent in a moment will explain a bit about that and provide some clarification. The second important aspect that will be presented is the clarification about, so if you are bringing additional contribution in the context of these collaboration actions, first, the nature of this contribution and the nature of the contribution that a contributing partner can provide. and also additional lesson learned and things that we want to be very clear about how to contribute as a contributing partner and the level of endorsements. So all these points that have been quite complex to handle previously, we expect that it will be much simpler and much clearer for everybody and all the parties for the call 26. We have had these big lesson learned, and now I'm happy to pass the floor to Laurent so that he can start. So many thanks for your attention, and we see a bit later on. Thank you.
Thank you, Vincent. Good morning to all. So yes, we will start immediately with some legal aspects that I would like to present to you. They were very focused on financial issues, you will see. So yeah, our classical start, like in any info day, for those who have followed us in the past, we always want to refer to the eligibility for funding rules. So here I would like to be clear that we're not talking about the eligibility to participate in our project. This is generally very open. However, we do have restrictions about funding and entities that we have the right to provide funding to generally. And you will see this in our work program. All the rules are set out there. But so to already tell you, this is like usually for entities that are based either in European Union member states or countries that are associated to the Horizon Europe program, or countries that are members of the EDCTP association. On this very point, I would like to also clarify that the list evolves. I mean, be it associated countries to Horizon Europe, certain countries have been associated from the start of the program, others joined later on, and some are still, even though we are reaching the end of the Horizon Europe program slowly, some are still in the process of joining. So this list is updated on the website of the European Commission. We also provide links on our website. But in some cases, you have countries that are under transitional arrangements, and when we prepare a grant agreement, we treat entities that are based there as if they were associated to Horizon Europe already and therefore eligible for funding. However, we still verify the situation before signing the grant agreement. So if you are based in one of those countries under transitional arrangements, please beware that you, depending on the situation at the moment of signing the grant agreement, we may or not provide you funding. So this will be assessed on a case-by-case basis, and we will discuss it when the times come, but I would like to flag it already for those that are based in these countries. And regarding those, the entities that are based in a country member of the EDCTP association, this also changes. There are countries that joined the EDCTP association still. It happened recently for Togo, for example. So yeah, please verify the situation at the moment we are preparing the grant agreement, and we will, of course, clarify the situation with you if need be. And then you see you see some other cases. Entities are based in other countries, exceptionally may be funded, but in this case, we need to consider the participation as essential. Usually, this is based mainly on the assessment of the experts during evaluation, but still to be confirmed at the level of the organization of the joint undertaking. So also to be seen case by case, but generally speaking, if your entity is not based in a country that I mentioned earlier, EU member state, associated country, member of the EDCTP association, in principle, you will not be eligible for funding and should rather look for sources of funding elsewhere, if possible for you. And this is also true for international organizations in general. So we can continue to the next slide. Another very important rule, very critical, is the consortium composition rules. So this actually conditions the eligibility of a consortium to even, receive funding, but simply to sign a grant agreement with us. It's an absolute must. I would like to flag this because very often we receive proposals that do not comply with this, and we cannot consider them, in fact, very often. So we please pay attention to that. You always need to have 3 legal entities or 3 organizations that are independent from each other. So this means, for example, they cannot be. You cannot have 2 organizations that are affiliated. For example, in this case, they are not considered independent from each other, which are all 3 then established in different countries where legal entities are eligible to receive funding. So here I'm referring to the previous slides. Please make sure you always have 3 in 3 different countries, and that they are, each time eligible to receive funding of EDCTP3 specifically, and not Horizon Europe in general. So really referring to the rules I mentioned just earlier. You also need to have at least one organization that is established in a member state of the European Union or in an associated country that is also member of the EDCTP association. Very important aspect to specify here. Because this is a condition that has been added last year, so it differs from the conditions we had at the very beginning of the program. So also, yeah, please pay attention to that. So if the entity is based in an associated country, there has to be a country also member of the EDCTP association. And last but not least, we also need each time an organization that is established in a sub-Saharan African country that is a member of the EDCTP association. So all these conditions are cumulative, and they are specific to the EDCTP3 program. They are not the same as under Horizon Europe. And yes, I would like to flag this also very specifically, because very often we get proposals that actually comply with the criteria under Horizon Europe, generally speaking. But of course, as I just said, we have specific rules. So please be aware of that when you submit a proposal and form your consortium. Thank you for that in advance. So now I will go to the really financial aspects related to the grant agreement. Here we're talking specifically about the most common type of grant agreement we use for the time being, which is the actual costs grant agreement. So in this case, you submit a certain budget and you report costs that are based on actual costs, even though you may have sometimes part of the cost, there may be unit costs indeed, and flat rate costs such as indirect costs. As you may know, we also use lump sum funding in some specific cases. We will have a presentation on this just after this one, after the Q&A of this presentation. But yes, still at the moment, our most common form of funding is actual costs. And when under this type of grant agreement, you have general eligibility conditions for the costs, and these are based on certain principle, but generally speaking, the most important for you to know is that they really actually have to be incurred by the beneficiary. You may need to demonstrate this. They have to be incurred during the action duration. They have to fit in one of the budget categories that are mentioned in the relevant articles of the grant agreement. So please have a look at Article 6 specifically, where all the rules are laid out. Also to be noted that there's an annotated model grant agreement, which you can find on the Funding and Tenders portal. And this is a document that provides comments and examples about every article of the grant agreement. So this can be very helpful for you to understand a bit better concretely how the provisions work. So I really encourage you to have a look at that. But yeah, in any case, in this article, you have all the budget categories under which you may declare costs, rules attached to them, and this will help you to shape your budget and make sure that when you report later on, you actually comply with the rules and your costs will be accepted. Of course, the costs have to be connected to the action necessary for the implementation. We have to be able to verify and identify these costs. This is important at the time of reporting, but also in case of audit later. You will need to be able to show documents, of course, to prove everything you are claiming, of course. So please make sure you have you're keeping all your documents and evidence about your costs as much as possible, be it on paper or electronically. And you, as always, need to abide by your national rules as well, and comply, especially with the principle of sound financial management. So you need to manage your project and deal with your finances as if they were your own. That's a bit the idea. You need to be efficient and reasonable, let's say. We can continue. So cost categories, that's just to give you an idea. You will find this in the grant agreement, but of course, like main categories are the personal costs, which can take several forms. As you can see, you have subcontracting, purchase costs of different kinds. When it comes to purchase costs, depending on what we're talking about, pay attention to the fact that sometimes only depreciation costs are eligible, for example, for equipment, certain equipment that has a long-lasting duration. You may not charge the whole cost to the project, but only the share that corresponds to the duration of the project. And then for these other cost categories, well, one that is very common is the internally invoiced goods and services, but in some specific cases, we also have projects that allow financial support to third parties, and that means concretely that the beneficiaries may provide grants themselves, sub-grants to other parties that are not part of the grant agreement themselves, and for this there are specific rules, but yeah, they're also mentioned in the grant agreement, and we can guide you during grant agreement preparation to make sure you will comply with the specific rules for these costs to be eligible. Indirect costs are automatically calculated, so this is not something you need to think about much, but well, there's a 25% flat rate based on most of the cost of the grant agreement. Long story short, you remove contracting costs, and all the rest is the basis for the indirect cost. And we can continue. So of course you have obligations to report to us periodically during the project, also at the end. Generally speaking, I mean, these rules are also in the grant agreement, of course, but we're giving a short overview here. There's a double deadline to submit the reports, which is of 60 days after the end of the reporting period. And then we have a deadline also to pay you, which is 90 days after the first submission of the report, provided the reports are accepted. Also, I would like to flag here that while we access the reports, if there are problems, if the information is not complete, if we have to ask you questions, we can suspend this time, and in the system we provide you the opportunity to adjust your report, and in this case the deadline is suspended. So in your interest, of course, you should address the concerns we have and the questions we have as soon as possible, so that you can receive your payment quicker. And when it comes concretely to submission, well, each beneficiary receives a notification when you have to start working on your report. Each beneficiary has its own financial statements to complete in the portal, and well, these have to be signed by the people who are assigned this role within your organization, and then ultimately it's the coordinator's role to check all these elements and submit them to us, be it for the periodic or the final report. And once this is done, so our project and financial officers review your reports and assess, well, the technical aspects, but also the financial aspects of the costs of this report. And then we provide you, of course, an interim payment, and at the end you get the payment of the balance at the very end of the project, which is, well, this final amount is calculated, of course, based on what we have already paid beforehand during the pre-financing and interim report stage. We can continue. So also related to costs, so you do have to report at certain moments, and at the end of the project you may have on top of this to provide with the final report to provide a so-called certificate on financial statements, so this famous or infamous CFS. So it's like a little audit. But this is only due when you have received at least 430,000 euros of funding from EDCTP3. So if you're under that, you do not have to provide a CFS. And I would even say, I mean, you may always provide one if you don't have to, but you need to know that the costs then would not be eligible, because if you have this obligation to provide a CFS, the costs you incur for them, as long as they're reasonable, of course, they are actually eligible under the project. So it will not cost you anything to provide this document, to reassure you. But yes, this is an absolute must. So please take this into account and make sure you have it ready at the moment of the submitting your final financial statements for your entity. And so this is really for each beneficiary, not at the level of the consortium. Well, there are certain rules, but it has to be provided, yes, by a qualified, approved external auditor, or in the case of public bodies, it can be also a competent independent public officer. I mean, the general idea is that the person or the persons who provide this report are independent and can make an autonomous assessment of the costs. And as you can see, there is a template for this CFS, which you can find on the Funding and Tenders portal. So if you think you will have this obligation, we encourage you to already have a look at that, to be prepared, of course, because from the beginning, you should, I think, take into account that you will have to submit this document at the end, which includes certain requirements also in terms of documents to be kept, evidence to be provided. So please make sure you can fulfill the conditions of this CFS, ultimately not to have any bad surprise for you. And there is also another document. This is much more rare, but there's a so-called CCS. I mean, we're following the model grant agreement, but you may notice that the acronym is in fact not following the term exactly, but this is how it's presented. So the so-called CCS. So this is to be submitted only by entities that have not received any funding from EDCTP3 under the grant agreement. I insist, like not a single cent. So in such a case, and if you are an organization that is related to a country member of the EDCTP association, or if you are a contributing partner, and here I want to insist, if you are a contributing partner, not if you are an entity that is funded by a contributing partner, and this is not covered, but really if you are a contributing partner, you are a participant in one of our projects, this may apply if you didn't get any funding by the JU, and if you provide at least 430,000 of in-kind contribution to operational activities, so-called ICOP. So in short, if you incur costs under the project that are at least of 430,000 that are considered eligible, and you do not receive any funding from us, then you have an obligation to provide a CCS. So it's pretty much the same as a CFS. What I mentioned earlier, you have to certify the cost in the same way and provide us this certificate. It works the same way. And this also applies if you provide a financial contribution under this grant agreement. So concretely, if you are part of the project and you, besides your activities under the project and any eligible costs, you also fund other beneficiaries under this project, this is also covered. And it can be, for example, 200,000 of ICOP and 300,000 of financial contribution. So you're at 500,000. And then you have this obligation for a CCS. It's not separated. So we're talking about the general amount under the grant agreement of ICOP or financial contribution. So yeah, the costs that are covered are also calculated on the basis of the actual cost following the eligibility rules of the grant agreement in the same way as for the CFS and our costs in general. And the same provision has to be provided by a qualified person who's independent. And we can continue. You may also have audits. So this is not automatic, but happens frequently enough. And we really encourage you to be prepared in any event. There is no very early warning. It's not necessarily on us to decide. So you may get audits by the Commission. You may it may be triggered really independently from the joint undertaking. So I think any beneficiary should always be prepared as if it would be audited at some point. You have the relevant provisions under Article 25 of the grant agreement, and it's really about scrutinizing quite tightly, in fact, like all the eligibility of all your costs. So please make sure you keep your documents once again. And this may happen at any moment after you receive a first interim payment, and up to a certain duration, even after the project is finished, after we've paid the last, the payment of the balance, the duration is indicated in the data sheet of the grant agreement, so you can know until what moment this obligation, this risk, let's say, remains. So yeah, please also make sure you keep your documents even after the project has finished. It's really important. And for example, time records for personal costs, that's a typical thing that can be missing. So yeah, please beware. We can continue. And now, I will actually already pass the floor to my colleague Agustin, who will talk about contributing partners in general and If needed, I will, of course, jump in. So, Agustin, you have the floor.
Thank you, Laurence. Thank you, colleagues. Good morning, good afternoon. Hopefully no one is joining us in the middle of the night. Thank you for joining this session on contributing partners. My name is Agustin. I'm Strategic Partnerships Officer at Global Health EDCTP3. And in the next few minutes, I will be explaining you what contributing partners are, why they are critical to the program, how you can become one, and crucially, what value this brings to you. So in the next slide, we can see that contributing partners are really one of the 3 types of co-founders of Global Health EDCTP3. They are essential in our ability to leverage limited resources in an already resource-constrained field. And as such, contributing partners really play a central role in enabling us to deliver on our mission and on our vision. And the EU matches contributions from members of the EDCTP Association and contributing partners, making their contribution really essential to maximize our 1.84 billion budget for the next decade. So turning into the eligibility in the next slide, you can see that contributing partners can be any public or private entity other than the European Union institutions, the EDCTP Association or their members, or crucially, public entities related to the EDCTP Association. Now, it can be philanthropic organizations and charities, private entities, both for-profit and not-for-profit, biotech companies, pharmaceutical companies, international organizations. Now, public entities such as public universities may participate as contributing partners only if they are legally registered in a country that is not a member of the EDCTP Association. Now, this is an important point because we know that many of our applicants are public universities. So if you want to be sure if your organization is based on an EDCTP Association member, you need to check the list of members, which is provided in the link in the slides. If you're not able to participate as a contributing partner, you may still contribute through the EDCTP Association, our second type of co-founder of our program. If that is your case, you can contact us in the email that we'll facilitate in the next slides, and we'll be happy to explain you the next steps. However, if you are ineligible to become a contributing partner, please also stay with us because we will explain soon how all contributions from contributing partners and other types of co-founders are valued and scored in our program. So why become a contributing partner, as we can see in the next slide? Well, it really helps first and foremost to leverage additional resources to deliver life-saving innovations for those that need them the most. And this approach also allows us to formally recognize the resources that research consortia bring to our cause, highlighting that our beneficiaries are not just conducting excellent research, but are also really committed to delivering impact by mobilizing their own resources, their own partners, their own networks. Crucially, this is a recognition that is not just symbolic. It really enables us, as I explained, to request much funding from the European Union budget and reach the program's total planned budget of 1.84 billion over the next 10 years. And therefore, contributing partners' contributions are really essential to implementing our program. But also for contributing partners themselves, this allows first to make their contributions visible internationally. It creates synergies and complementarities with our own funding and other funders. And for project applicants that become contributing partners, which I suspect will be many of you, or I hope it will be many of you, this really increases your chances of success in your project proposals as your contributions are counted in project evaluations. And we'll be explaining that in a few minutes. Now, in the next slide, you can see in a nutshell what type of contributions are possible. It's a rather busy slide, but just in a nutshell, you can see that contributing partners can participate at call level or at project level. Call level partners co-fund and co-create a call topic with us, pulling resources together for greater collective impact. And organizations involved in co-creating a call, of course, cannot apply themselves to projects funded on that call topic. This is mostly aimed for funding agencies and philanthropies, and we don't expect research organizations to really co-create call topics with us. What we do expect is research organizations to contribute at project level, so the second level. Most of you today are research organizations rather than research funders. So this is really the approach we would expect from you. And this is when you bring your own resources into a project proposal or include funders as part of your consortium, or bring external funders to support your specific project application. And they can support, or you can contribute by providing cash contributions or providing in-kind contributions, or a mix of both types of contributions. Now, in the next slide, you can see how are contributions considered and evaluated. This is really a question that many of you have asked, so I'm going to devote a few seconds reading this slide. Importantly, cash contributions involve really bringing financial resources into your project proposal, like if you have a philanthropic organization covering a portion of your project costs. In-kind contributions are the resources that you bring, and they must follow Horizon Europe eligibility rules, as explained by Laurent. They need to be really eligible cost, actual cost of planned activities in your project proposal, and not estimates. They need to be necessary for your project proposal, and you have to explain that in your project application, and they need to be incurred during the project implementation, not before and after the project has been started or been concluded. And they need to be provided by eligible contributing partners to be considered contributing partners' contributions. Now, the principle is fairly straightforward. You look at the total project costs that you are declaring in your project proposal minus the grant amounts that you're requesting, and this is a contributing partner contribution. Now, they need to be declared by individual organizations and not by the consortia itself. And then in response to some of the questions that are in the chat, let me clarify a few points. Co-funding contributions are not an eligibility requirement under any call topic. So your proposals will not be rejected if you have no co-funding or no contributing partner contributions. All co-funding contributions from contributing partners or other co-funders are scored in stage 1 of the project evaluation under the impact criteria. And contributions from contributing partners under global collaboration actions, which are all the research and innovation actions under Work Programme 2026, are evaluated and are scored in the second stage of the evaluation under the impact criterion. That's any kind of contributions, and under the implementation criterion, but only if they are equal or exceed the EDCTP3 funding that you are requesting. Eligible co-funding contributions, again, can only be scored positively in the evaluation. As Jean-Marie explained in the previous session, they can never result in a penalty. In the next slide, you can see really where do you need to reflect that in your proposal. And you see the budget table used in project proposals, and it's really crucial that your co-funding contributions are clearly reflected in the budget that you see in the screen and that are explained in your project proposal so that we can properly assess them and score them. And in the 2 blue arrows that you can see on the table, you can see where your co-funding contributions are declared. Financial contributions are cash contributions. Own resources are all sorts of in-kind contributions to operational activities as eligible cost, as explained by Laurent in the previous slides. However, to be formally recognized as a contributing partner, there's one additional step, which is explained in the next slide. And that is that you must submit a letter of endorsement, which needs to be approved by our governing board. Now, this letter must be sent from each eligible organization that wants to become a contributing partner, and it needs to be sent to the functional mailbox that you see in the screen. There is a guide that we encourage you to check so that you have a better understanding of contributing partners' requirements. And it is important that if you're aiming to become a project-level contributing partner, you bring in contributions as part of your application to a project, that those letters are submitted as early as possible as you have your consortium configuration finalized, but certainly before the final project submission deadline. You need to check the specific deadline in the call topic that you're applying to. And that is if you want your co-funding contribution to be scored and considered positively in the evaluation. So for project level contributing partners, the contractual details of your contribution are agreed under grant agreement preparation if your project is selected for funding. If your contributing partner is not part of the consortium, or for call level contributing partners, the specific details of the co-funding contribution are agreed in a separate document in a funding agreement. Then a quick reminder then of the timeline in the next slide. This is the recommended timeline for project level contributions. That is for organizations that will be requesting funding, but also providing some sort of co-funding. Please submit the letters of endorsement between March and July, not later than July, assuming that the deadline for submission of proposals is September, which I think is the case for most of our call topics. If you are interested in co-creating a call with us, then you need to do it at the beginning of the year so that we can ensure that your input is included in the work program preparation and in the implementation of the call topic. Two more final slides from my end. One is this critical one based on the lessons learned from 2025. So the top 5 mistakes with letters of endorsement. Letters that are not in template, therefore they are missing legal provisions. And I insist there is a template. You don't need to invent the letter of endorsement. The template, you can find the link in this slide. And it's a 2-page document. It's a very simple document, and you just need to provide it with few information that is declared in the template. Make sure that the letter is signed and signed by an authorized person by each organization. That is submitted by an eligible entity. So if you're a public university in an EDCTP association member state, you cannot become a contributing partner. You can contact us and we will explain you the ways in which your contribution can be taken into account and also scored. The total co-funding amount in the letter should match what you are declaring in the budget proposal. Please make sure that this happens and is consistent. And please make sure that basic information in the letter is there so that when we are reading the letters, we actually know, who are you, what project are you, what is your project that you're submitting, what is the call topic you're applying to, and a very, very short description of what is your co-funding contribution about. So recommendations, check the guide that is available and use the template. Please verify that the applicant is eligible and that the costs you are declaring are eligible. Make sure that the letter on the project budget match. And if you want us to take a look at your letter of endorsement and provide comments, just suggestions, if you're unclear, please contact us through the partnerships functional mailbox as quickly as possible. You can also share a draft letter with us in Word, and we can comment on it if you do that in due time. And that's the final slide. Is the next slide. This is a reminder that we have a dedicated networking platform to connect with partners, contributing partners, funders, and it's already open. You can just scan the QR code to access this. And we really encourage you to use this platform from now, as from stage 1. And especially if you are shortlisted to stage 2, you can still use it, as Sylvia explained before, and potentially add contributing partners to your consortium to reinforce your proposal, because this could make it really a difference in the success of your proposal when it's evaluated in stage 2. That's all for me. Thank you for staying with me so far, and looking forward to your questions.
Thank you, Agustin and Laurent and Vincent. Don't go anywhere, because we now have, oh, you've gone. I think you're coming back. We now have a Q&A session to cover this particular section, but also any outstanding questions from the earlier presentations. And I think, and I hope that this last set of presentations addressed many of the questions that we had in the Q&A around co-funding and the process for that. I put some comments in those Q&A to just ask you to add an additional comment there in case, for whatever reason, you still need further clarification following these presentations. And otherwise, we will assume that you've hopefully got the information you need. So there was, Agustin, I'm going to just address one of the questions. There's a couple of questions in here that you might want to just elaborate a bit more on. You just touched on the networking platform. There are a few questions, a couple of questions from our participants, anonymous participants, around how potential applicants can identify in-kind contributors, whether they have to be matched in the project through the portal, should they put any reference to them at the first stage proposal, do we help them in some way to meet each other? Maybe you want to just talk a bit more about the platform and the purpose and how this can help potential applicants.
Sure. The networking platform is really a matchmaking tool, and we've really designed it to help participants connect and collaborate on proposals for our open calls. And you can identify the call topic you're interested in when you are registering or to the networking platform. It allows you to create a profile, to showcase your expertise as well, and just pitch services. So for any interesting party to contact you. It allows you to book virtual meetings through the platform itself, to browse participants' proposals, so participants can also disclose project information and share as much as they feel comfortable with. It's crucial to understand that we ourselves in the joint undertaking, we don't connect and we don't interfere in consortia configuration. So this is why we have this platform. It's a neutral space, and it's a means to ensure that everybody has an equal opportunity to connect with funders, contributing partners, with the research organizations, and have as many chances as possible to identify potential co-funders for the project proposals. So we ourselves, we are not connecting any organization with a co-funder, because that would be interfering in the consortia configuration and creating a distortion in the project application. So that's why this platform is for contributing partners and for interested researchers. Use it, and it will be open for the duration of the project preparation. Then at some point it's closed because it's really designed for every work program, and in 2027 it will be reopened and still tailored to ensure that applicants can find suitable contributing partners and other partners for the next work program.
Thank you, Agustin. So there's a question also a bit related to, I think it's been partly addressed, but maybe it's good to just elaborate a bit more. Either you or Laurent could elaborate on. Someone seeking, this is Clara I apologize, I'm going to say this wrong, Vekasea, who's asking for clarity on stage 2, when it's mentioned that applicants should have co-funders. Does it have to be funding, or can it be capacity needed for certain technical aspects of the study? And I think I read somewhere in one of the other questions asking a similar question around, I guess, the in-kind contribution aspect. So maybe you want to clarify this, Lisbeth.
Yeah, I can come in on this one. So first thing, I would like to know what we mean exactly by capacity, but I assume that it may be some material, some equipment, some sites may be provided. But in any case, for it to qualify as a contribution, as an in-kind contribution, it has to be an eligible cost of the project. So for example, if the entity concerned incurs costs that are eligible under the project, so following the rules of the grant agreement, and that these costs are not reimbursed by EDCTP3, then there can be a so-called ICOP, so in-kind contribution to operational activities, and be counted, yes, as co-funding. However, if the contribution is actually something that doesn't fit in a cost category, and the entity concerned does not incur costs, but is just, for example, given access to some facilities, in this case, let's see, case by case, but if you receive access to certain facilities by another organization, but you do not incur costs for it under the project, this cannot be counted as a contribution in that context, even though, of course, it's appreciated, it's a plus for the project, for the proposal, but it doesn't necessarily qualify. So I think here, when we talk about capacity, I think we really need to see case by case what we're talking about. And if you have a specific question in your case, and you would like to know a bit more in detail if it could potentially be an ICOP, please come back to us with the specifics, and then we'll answer you on that.
Great, thanks, Laurent. And maybe just to build on that, because there's a couple of additional questions that are a bit more specific, both a bit similar. One is from an anonymous participant, and the other is from Michael Edelstein again. And this relates, so the first is, can the contribution of investigational medicinal product by a partner qualify as co-funding under the Global Collaboration Action Calls? And whether for the two-stage calls, for the co-funders, for example, a pharmaceutical company donating a vaccine dose, whether they're expected to be mentioned as a consortium member in stage 1. But I think also maybe to just respond around the donation of products.
So again, a little disclaimer, I think I would rather see really specifically case by case what we're talking about. But if I understand well about these two questions here, we're really talking about, yes, for example, vaccine or anything that is used during research. I think here we're probably talking about elements for which the beneficiary concerned will not incur costs. The beneficiary will receive certain products, and that again is a plus indeed for the projects. It's great to have some external contributions, because concretely it means that these elements will not be charged under the project. However, because the beneficiary will probably not incur costs, it cannot be used as a basis to calculate some ICOP, and therefore this would not qualify as a contribution under a global collaborative action. But yes, just to be sure, we can also tackle this specifically separately to see if it corresponds to your specific case.
Laurent. A couple more questions related to in-kind contributions. So these are, Annette, hi, nice that you joined us. Annette Mahon from the NDI has a question around if you have an industry representative wanting to contribute in-kind funding to a particular project, does this partner have to become an official member of the consortium, or simply state that they're providing an in-kind contribution to the project with details provided? In other words, why does an in-kind funder need to become a member of the consortium? And well, related but different from an anonymous participant, whether for the in-kind contributions it's preferable for the co-financiers to be European, African, or whether it makes no difference.
Yes, so I mean, yeah, we're turning around, I think, the same type of issue, but here I would like to stress, I mean, to refer actually to the definitions, because like, we have to pay attention to what we talk about when we say in-kind contribution. An in-kind contribution, as we refer to it, we talk about ICOP, so a contribution that is a contribution to the joint undertaking that is eligible to be considered as co-funding under these topics, is really about eligible costs incurred by a beneficiary within the project. So it's not a donation of, for example, a consumable or vaccines that will be used during the project, but without it implying incurred costs by the entity participating in the project. And very often we hear about in-kind contributions as in a generic way, as a generic term, which is absolutely correct, but not in the sense of the definition of ICOP. So I really would like to stress this difference, and like in relation to that. So the question was, does the entity the organization have to be part of the consortium? Well, by definition, if you want to generate ICOP, you need to incur eligible costs under the project, and to incur eligible costs under the project, you have to be a beneficiary of that project. And also, again, mechanically, to be a beneficiary of an EDCTP3 project, you need to be eligible for funding, even if you don't receive funding. That's a rule we have to comply with. So in this case, if you are based, for example, in the United States, unless you are declared essential for the project, you will not be eligible for funding, because by default, US-based entities are not eligible for funding of EDCTP3. And in that case, yeah, you may not be a beneficiary and therefore not incur eligible costs. So maybe this is a bit complex. There are many links between the different ideas and concepts. We can come back to it, of course, and you will have answers in the Q&A. But it's really important to pay attention to that, and really, like, let's see what we talk about when we talk about in-kind and what does it refer to exactly. But long story short, always keep in mind that ICOP means eligible costs under the project, incurred by the beneficiary under that specific project. Over.
Great, thank you.
Or Vincent wants to complement, maybe?
Oh, go ahead.
Well, I wanted to verify with him person, in order not to say something stupid, but indeed, and that's what we discussed also about the stage 2. So you provide in-kind contribution to the action. So this would be evaluated as such. It has to be eligible costs. The part that I wanted to verify with Laurent is that if you're not part of the project, you can provide financial contribution to benefits of the project that are eligible. So it's not counted as ICOP as such, but it is counted as financial contribution. So this works as well. Okay, it means that one of the beneficiary have to provide additional contribution and so on, but it is financed by another contributing partner, not being part of the project. Okay, so it is not, in the definition, it's not ICOP, but it's part also of the contribution that we can expect.
Yeah, and just to complement very quickly, indeed, but please bear in mind that what is funded by a contributing partner in this case, so providing a financial contribution without being part of the consortium, what can be counted is still eligible costs of the beneficiary funded. And just to make this clear to all, that's like the basis of our calculation of a contribution, be it financial or ICOP, is always eligible costs under the project following the rules of the grant agreement.
Exactly.
Okay, hopefully that's a bit clearer now. So we're going to take one more question around the co-funding, and whilst that's being responded to, we're going to just bring back some of our colleagues that were presenting earlier to maybe address in the last 10 minutes we have of this Q&A some more of the questions around the calls. There was one question that I thought would hopefully be addressed, but it seems that there's still some clarification required. And this is around, this was a question that was submitted by Alberto Garcia Bastiero. Thank you for your question. It's around the evaluation and the evaluation criteria, right? And having co-funding. So the follow-up question is around stage 1 evaluation. How will co-funding contributions be assessed? Does it only affect the scoring at stage 2? Could you elaborate on the statement made before on proposals not being penalized if they do not get an equal or greater amount, but those who will bring amounts will be rewarded? Did you want to just say a bit more about this, maybe just to give, apparently it wasn't clear enough for some colleagues.
Yeah, just to maybe elaborate on what we mentioned earlier, in phase 1, stage 1, you don't have to bring a lot of details, don't have to submit these letters of endorsement. But I was mentioning that it is worth for the whole complete picture that the evaluators need to mention that you are going to bring in contribution, because sometimes your budget, if they look at the requested budget and describe the activities, they may think that it will not be feasible, that they may think that you are maybe requesting too much or too low. So it's important to mention that you are in the process of seeking contribution. But in the second stage, where it applies to the evaluation criteria under impact, leverage the funding is part of what our evaluators will be looking at. And where we kept saying not penalizing, but impacting the score, it's where you bring an amount which is equal or greater to what you are requesting. Under the third evaluation criterion implementation, your score will be greater than, for example, a similar proposal that may have not given a co-funding which is greater or equal or greater. If it is below what you requested, it is still noted that your project will leverage co-funding, but it will not lead to an increased score. I'm not sure if that makes complementary, if it comments to what you had said, but in short, it's that.
Sorry. Did anyone want to add anything, or do we think that's hopefully there? I think we'll leave it at that, and in case there's anything that's still unclear, please just send through the applicant's email address. So we have about 7 minutes. We're going to still try and plow through some of these questions. There are a few that have been upvoted, and Tom, you might want to take this one. There's a couple, and I see Pauline, thanks for responding. Pauline Beatty from the EDCTP Association has been responding to some of these questions around the role of the EDCTP Association, but maybe because it's been upvoted so many times, and there's a couple of questions around whether the association can act as a coordinator in more than one consortium in these core topics, and also how applicants can submit whether they should submit the application first to the EDCTP Association office in advance for review, and what is the deadline for this. Maybe Tom, you wanted to just mention something about this and the info day you have planned as well.
Oh, thanks very much, Laura. Yes, so those are some of the nitty-gritties that will be presented by my colleagues. As you've mentioned, one of them is Pauline, on the 25th of February. But you know, these issues should come to us, and we see how we can do it together. In the previous calls, there was a mixed method approach that we saw, that some people started, you know, making the application and then reaching out to the association and trying to say, should we add you? What are you going to do, etc., etc. But if we discuss together, it's much better to communicate with us, so that the application is done not in parallel, but in sequence. Because we have, I know last time people were kind of not privy to what the work packages, for example, of a coordinator should look like. And we have that. And if we share that with the consortium scientific project leader, it makes it easy. And so, you know, the application also works very well. And as you know, the system is responsive. Once you start populating the co-applicants and the fields, they all receive notification that this is happening, and so it's, in my view, it's much better to do it after a small discussion or exchange of emails, because we have created what we call a general email for the coordination, CSA coordinator at edctp.org. This information will be shared on the 25th. And that email, that's where we receive information about your interest to apply to the call, and also answer to several questions that you have. And then we do the process together. I think learning from the past is better to do it together than one going ahead before the other and then coming back to discuss and saying, but what do you want to include as your core activities, etc., etc. Because they also get information from our side about also how to complete the finance forms, which are a little bit more complicated if you start to do it on your own, and then you have to add new information in those forms to add the coordinator and other things that you never discussed before.
Great.
But
in
short, let's encourage everyone that is interested in those two calls to attend the info day on the 25th, because all these steps will be explained by my colleagues to make it easier, and then we move together as a group when we decide.
Thanks, Tom. We'll take a couple more quick questions before we go to the next presentation. One quick one, and this is pretty much dependent on the call, but I'll leave it to Jean-Marie or Sylvia to respond, is what is the duration of each award?
Yeah, that's a good one. So in the past, I think a lot of participants were used to see duration, recommended duration or indicative, but we don't do it in these calls. It is up to the applicants to define the duration of the projects, but maybe it's also a legal question, because this is an organization which is implementing projects that have to be closed by 2031. Laurent or Vincent may come in when we have the deadlines to report on these projects. So if these grants are going to be awarded at the end of 2026 and we sign them in 2027, you don't want to propose a project which will go beyond 31, which will go 6 or 7 years. So it has to be in the timelines of this organization. But maybe Laurent can come in. Before I just stop, there are some of these CSAs, for example, which may be shorter in terms of when you have to run a CSA where you have training activities, compared to some of these areas where you have maybe a drug development program, which can be a number of years. So CSA versus RIA, duration may be longer or shorter, but vis-a-vis the end date of the organization, maybe Laura or Vincent can comment.
No, I think this is really complete, and we should actually stay with this idea. But of course, since you're inviting me to complement a little bit, of course, we don't know if there will be an EDCTP4 at the time being. Of course, our organization may actually exist for longer than 31 if the European Union decides so, long story short. But we don't know at this stage. But if the lifetime of organization is extended with a new program, it could be, I say really, it could be that some projects at some point may be a bit longer because we will still exist and be able to manage them. But there is absolutely no certainty about this, especially at the time you will submit the proposal. So you should really start from the assumption that by the end of 31, we will not exist anymore, and therefore your project should have finished before that. So what Jean-Marie said is what we should stick to, I think, for the time being. Yeah, let's see in the future, but we really cannot speculate about that.
Okay,
if I may just complement, so Laurent is right. We are bound to respect the timeline of the program, and if we refer to the previous programming period, what has happened, extension may still be possible depending on the lifetime, and also in worst case scenario, the commissioner will take over this grant and so on. So, but we are optimistic and praised for finalizing anyway all operation of our program by 31.
Awesome. We're going to squeeze in one last question before the next presentation, and that's, can consortia apply for multiple calls? Don't know who wants to take that one, but
yeah, it's allowed to apply to multiple calls. It's many of you do it to just look for chances in different topics.
Okay, so now we're going to, there are, I see, of course, many more questions. We have one last Q&A session. We'll try to get to them after that, but we just want to try and stick to time as much as possible. So if you have some questions, burning questions that you want to be answered, please remember to upvote them, because we'll come to those ones first in the last section of the Q&A. And maybe just for our colleagues that are about to do the next presentation, I already saw there's one question on lump sum funding proposals, so you might want to try and address this whilst you do your presentation. And that is from an anonymous participant saying, is the involvement of the EDCTP Association mandatory? Will proposals that do not involve the EDCTP Association be reviewed negatively or as unresponsive? I'm not really sure that that specifically relates to lump sum funding, but in any case, this was how it was phrased. So we will now stop this Q&A section, and my colleagues Sylvia and Vincent will stay and now take you through the presentation around lump sum funding, which is specifically being used for the two CSA core topics. Over to you guys.
Okay, thank you very much, Lara. And indeed, it's the last presentation for today. So we will be presenting the lump sum model funding approach for the coordination and support actions only. But if you are an organization that you have submitted a RIA and you want to or are interested on knowing more about lump sum, please remain with us. I'm also pleased to co-present this presentation with my colleague Vincent de Clefard, the Head of Finance and Administration, that he will be covering the second part. And maybe before, addressing the question that you, Lara, before I start and hit the moment with the lump sum specificities. So I think the confusion is because last year for the two CSAs that they had the lump sum model funding as well, we had the obligation that the EDCTP association needed to be the coordination. I want to clarify, and Tom, maybe after on the Q&A, you can clarify it better. It's not mandatory. It's a possibility, and I think that's one of the reasons why the EDCTP association is inviting applicants to this webinar on the 25th of February to clarify roles and responsibilities and how they can help on the applicant submission. I mean, they have the expertise from last year and from previous years, so always useful to have them on board, I guess. So with that, next slide, please, and I will start with lump sum. So to start with, I think it's fair to mention that despite all the streamline of processes, so the reimbursement of actual costs remains complex and prone to errors, and there is little scope for further simplification. So the lump sum advantage, one of the advantages is that it removes the obligation to report actual costs and resources, and it should be easier also for beneficiaries with limited administrative experience to manage their finance. So basically, the main advantage should be that you will spend less time on the financial management of the project, and you then will have more time to focus on the scientific technical work of the project. And as you would remember, and I mentioned before, so last year we conducted a pilot with lump sum model funding approach, and that was related to 2 coordination and support actions, the network of excellence and fellowships. And I mean, we are now currently on the grant agreement preparation phase for these projects. So that pilot has been the opportunity for us to test and to learn about the lump sum model specificities. And as we see the value, there has been a decision that the GU continue this year and extending the pilot for the work program 2026 for the submission and the evaluation of 3 coordination and support actions that I will present later on, and that they have been presented earlier under the work program. So, and just to finalize on this slide, to mention that this is an opportunity for the GU, I mean, starting from the pilot and the extension now, to really join forces with the European Commission research strategies and with the Horizon Europe program of funded projects. So to join forces in the simplification of processes. Next slide, please. So as I mentioned before, for the work program 2026, the submission, you will need to think when you prepare the proposals for these 3 CSAs, the coordination support actions, to present it with a lump sum model funding approach. So those 3 calls that are applicable are SERP, so Training Networks for Sustained Capacity Building related to ethics, regulatory and pharmacovigilance, DIGIT, so the Enhancing Integrated Research and Healthcare in Sub-Saharan Africa through digital innovation and artificial intelligence in the region, and last but not least, the IBIA, expansion and consolidation of the EDCTP Knowledge Hub. And as mentioned before by Tom, so there is a webinar that they will be running, EDCTP Association, if you want to see more specificities around including the EDCTP Association for SERP and DIGIT. Next slide, please, on the 25th of February. So to continue with, so when we talk about lump sum evaluations and grant agreement, you need to understand that these follow the same standard approach as if it was actual cost grant. So that means that we apply the same evaluation criteria. We will see it later, but it applies to excellence, impact, and implementation. We use the same pre-financing and payment scheme, and we also use the regular reporting periods and technical reporting. So the main difference between actual cost grants and lump sum is that the focus of the project is on the completion of the work package. So what does it mean? So the payments are subject to the work package completion and the completion of the activities. As actual cost grants, the work package can be modified through the project life cycle, and this would be done via amendments, and if there are changes on the description of action related to new scientific developments or consortium composition, so the like actual cost grants, so termination, adding a new beneficiary coordinator, and so on and so forth. So the fact that we continue with the lump sum for CSAs is because, as I mentioned before, we see the value on the simplification of the process, but there is no intention or no basis for judging the performance of these lump sum grants more strictly than the performance of other grants, so no worry about that. Next slide. When you will be preparing your proposal, you need to understand that the model that we apply is the type 2 that appears in this presentation. So you will be defining the lump sum in your proposal, not the lump sum is not defined at the call level. And you need to take in consideration the presentation today and how to present and submit a proposal in case you are submitting for any of the 3 CSA topics of the work package 2026. So this is not what I want to make it clear is this is not applicable for RIAs. So for the topics that my colleague Jean-Marie presented earlier. Next slide. So when you are preparing your lump sum proposal, you need to consider using the standard Horizon Europe application form as you were using for another actual cost grants. Then you need to think on regularly as another proposal presenting the objective and methodology of your project and address the expected outcomes and impact as in any other Horizon Europe proposal. So in order to convince or to make more strong your proposal when it comes to the evaluation by the independent panel of experts. The main difference is you need to think it twice on how you describe very in detail the activities covered by each work package, because this is let's say that this is the basis for the lump sum payment. You would also need to provide a detailed budget table with cost estimations, that these are what we say the best estimation of your actual cost, and this cost estimation need to be defined by category and per beneficiary. As I mentioned earlier on during the work program presentation of the topics, this is a single stage for the CSA. So that means that you will not have the opportunity to have 2 stages, have submission of one short proposal and one full proposal. So the proposal that you are going to submit on the 2nd of September, this is the proposal that will be evaluated by the independent panel of experts and at once. So there is only one evaluation. So here in the slide, we have provided to you some links that can be useful of your interest. So where to find the lump sum budget table, so the Excel table under the funding and tenders portal, and 2 practical links on best practice for lump sum grants. And also there is an upcoming webinar on the 11th of February that will talk about how the lump sum funding in Horizon Europe works and how to write a proposal. This is on special interest if you have never submitted a proposal under Horizon Europe. I mean, it can be that you have not submitted to us, but to another project, and then you have some familiarity to that. If not, please try to join the webinar that it's done by our colleagues from Research and Innovation, and there will be the opportunity for a Q&A as well. Next slide, please. When you prepare your proposal and before submission, you also need to think twice on the work package distribution. So you need to know that you can use as many as you need, but this needs to be realistically manageable. Just as a reminder for you, what we consider as a work package is a major subdivision of the work plan of your project. We don't consider as a work package a single activity, not a single task, not a percentage of progress, and not a period of time. So for example, activities during year 1, this is not considered as a work package. However, and this we have noticed during the evaluation, we strongly would recommend you, this is not mandatory, but this is not an obligation, but it's a strong recommendation that you split the work package with long reporting periods. So for example, when we talk about coordination and management, dissemination and exploitation, communication activities, because this way will facilitate that the activities completed on these splitted work packages are paid at the end of each reporting period, because otherwise you will need to wait until the end of the project to get any payment related to these work packages. When we move to the evaluation of the proposal, and I think I briefly mentioned before, so this applies the regular evaluation criteria with an independent panel of experts. So they will be assessing your proposal and scoring on excellence, impact, and implementation. And important for you to know that the main difference with lump sums is that the cost estimations that will be assessed by the independent experts are scored and assessed under the implementation criteria. How they do that? So our GU will provide statistical data that it's a kind of benchmark and will facilitate or will orientate the experts on the budgets that you have provided under the Excel, and then based on that they can consider if what you are presenting is reasonable and non-excessive. If you, when preparing the proposal, you already know that the cost, the best cost estimation that you are presenting are high in personal cost, for example, or very below the personal cost, please provide any comments until the Excel detailed budget table. So in order not to be to get recommendations or being penalized, because if the experts find overestimated costs, they can make concrete recommendations, and this is kept under the evaluation summary report. And this is one of the main differences between actual cost evaluations and lump sum. So under the implementation criteria, they can make recommendations that will be fixed or that will need to be fixed during the grant agreement preparation, and that will be brought to your attention by the project officer or the financial officer that is coordinating your gap. Then cost estimations that are clearly overestimated or underestimated, this may lead to a decrease on score and under the implementation criterion. So this is important for you to know that you can be penalized if you don't provide the comment under in the Excel table. What else the experts are looking at? Can you please go just back to the previous one, because I missed 2 points. So it's very important that you complete the declaration by the beneficiaries of having used their own accounting practices. This is something that the experts, they are looking at, and this is part of the description of action part A. Next slide, please. So when we move to the grant agreement preparation, it's important that you get familiar to the model grant agreement for lump sum grants, that here we provide the link. So this grant agreement is very similar to the actual cost grants. It has the majority of articles very similar, with the exception of the finance part, because one of the difference that I mentioned before is that you don't have the obligation, lump sum remove the obligation of reporting the actual cost. We apply the non-negotiation principle. So that means that we prepare the grant agreement based on the proposal you have submitted. And as usual, so we, the GU can come to you during the grant agreement preparation in order to correct obvious errors and inconsistencies or other changes that are necessary to comply with our rules. So for example, the consortium composition, or the peak numbers that there was a question early from the Q&A. The main difference is that the adjustment on the lump sum that has been brought out by the evaluation, so by the experts, and that they are recorded under the evaluation summary reports, then they will need to be fixed before any signature of the grant agreement. And also one of the differences with the lump sum is that the shares of the lump sum, the breakdown per beneficiary and per work package, is fixed at the level of grant agreement, and this is part of the Annex 2. So the budget table in Excel that you provided during the proposal, this is not part of the grant agreement, but the information of this budget table that was evaluated and assessed during the evaluation, so it will be pulled directly to the Annex 2. And the good news is that once the lump sum is fixed in the grant agreement, then it will not be questioned anymore if the prices for goods or services will change afterwards. Next slide, please. And I think that's my last slide before I hand over to Ban-san. So here, what I would like to present to you is how this Annex 2 looks like into the grant agreement. So as you can see on the first table, there is the lump sum. So there is a breakdown of the lump sum shares are fixed by beneficiary in work package. So if we, for example, take in consideration work package 1, we have two beneficiaries that are contributing to that one, beneficiary A and beneficiary C. And the main difference that lump sum offers is that the 350,000 will be paid only at the end of the work package 1 completion and when all the activities are completed, not before, not after. The thing that I would like to mention also is that the transfer or the shares between beneficiaries and work packages are in each work package, sorry. So if we take work package 1, we see who is contributing, but we don't see the amounts. So this is invisible to us. However, if during the project implementation, if you would like that any transfer between work packages or partners are reflected in the grant agreement, then we will be requesting you an amendment. And with that, I will hand it over to you, Ban-san.
Thank you, Livia. So for the continuation, I will start with the payment schedule. We would like to reassure everybody that in the scope of our lump sum action, we keep and maintain the same approach for the payment. So we will have a pre-financing payment at the signature of the grant, an interim payment, and payment of the balance of the payment, the balance of the grants. The interim payments, as mentioned earlier, are calculated based on the completed work packages and the payment of the balance similarly. Next slide, please. So in a detail, and referring to what I was saying about the completed work package, is there is no more financial report anymore, so you don't need to report on your actual cost. This was already evaluated at the evaluation stage and ex ante on the nature of the cost you are considering incurring in this action. So once the grant agreement is establishing clearly the lump sum share for each of the work packages, once a reporting period is completed, the system is automatically calculating the financial report following the number of work packages completed at the end of a reporting period. And this will be automatically generating. So sorry, you've been a bit too fast. Previous slide, please. Thank you. Calculated based on the beneficiary. So, for instance, if I take the example of the work package 1, if the work package 1 in the screen is expected to be finalized after the first reporting period, we can see that all activities worked expected to be delivered for the work package 1 is completed. So 2 beneficiaries have been contributing, 2 have finalized. So in that case, we release the work package number 1 payments. For work package 2, if there is a delay with beneficiary C, then there is no payments for this one. To be noted that it is a recurring issue raised or matter of concern. We always have the possibility to generate some adjustments in the course of the project. If one beneficiary is delayed, we can proceed when necessary to amendments and do a rescope, so ensuring that you continue having sufficient cash for the continuation of the project. So next slide, please. And then, as I was explaining, the work packages are therefore accepted if the activities have been carried out. Sylvia explained We do not intend to change the approach for all projects. The main focus is the technical achievements. And even though the financial statement will be automatically calculated, what we pay attention is the technical report. We can adjust, as I was just saying, the lump sum with an amendment. And in case we need to reject something at our level, then you are invited to respond to the observation of project and clarify, but this is exactly the same as is in a normal and actual cost grant. Next. There is also something that changes about the ex post, and it's another element of simplification, considering that there is no more financial ex post control. So you do not have any financial audit anymore. There are some ex post review checks focusing on technical parts. So what is done is that there are some review work done during the implementation of the grant or after, ensuring that the action has been properly implemented. So that's the technical review, which is done in complementary, and also compliance with other non-financial obligation of the grant, intellectual property right obligation, ethics, integrity, open science, dissemination, but nothing about financial check. However, we can also verify the source and if the work has really been done by who. So this is something we can do, but not specifically about financial parts. Next, please. So the obligation is to what you need to keep, and the obligation of keeping record as per grant agreement. So you need to ensure you keep all the technical documents, the publication, document required by good research practice, such as lab books, and any document proving that the work was done as per Annex 1. That's what I've just said before. If your usual accounting practice doesn't require the use of timesheet or payslip of contract, this is not requested specifically anymore. We are not verifying that in that way as it is applicable for the actual cost grant. Next. Sylvia mentioned there is a specific budget table. To be noted that from a technical point of view, there is no, in the tool, not yet, direct integration allowing you to directly do the inputs in the tool for your project review preparation from a financial perspective. You need to work on an Excel file, okay? So we expect that in the next 1 or 2 years, this will be embedded in the system. So one important point is you need to ensure that there is a consistency in your proposal between the summary budget table, which is here on top of the screen. That is a table you need to input manually, and then the Excel file that you have prepared. So the budget table is summarizing the different part of the grant with the different, well, not cost categories, but what kind of contribution you have, and also if you have financial contribution of ICOP. The Excel file I'm about to present just now. Next slide. So once you have the budget table, Excel file, it allows you to calculate for all beneficiaries, all work package, what will be the cost that you will submit in your proposal. So the ultimate goal of this table is to have a summary review of your project that you can copy paste into the budget proposal in the part A. So first step is the instruction, explaining everything. You need to have some technical requirements. This is visible in the slide. You can see that afterwards. And then each step allows you to construct and build your proposal with the number of beneficiaries, the list of work packages. So for instance, if we go to the next slide, we will see that one of the important tab is the one listing the number of beneficiaries. This is where we say we identify the role, if it's a coordinator, affiliate entity, beneficiary, the funding rates, and then you can manually add a beneficiary, add an affiliate entity, and apply change, the tab works, the document works with macro, and it automatically creates as many tabs in the Excel file as you have beneficiaries, so that each time a beneficiary is indicated, you will have a specific tab for describing all the expected budget forecast for the project. Next. So another tab that is important is before you can start encoding the financial data for each beneficiary is preparing your project overview, as Sylvia explained previously, number of work packages that you will have. So this is very good, very important for you to have this overview. How many work packages we will have for the project, how many work packages we need, also per reporting period, ensuring that you have sufficiently cash and reporting along the project duration. Once it is established, add to the work package, apply changes, and then if we go to the next slide, we have this overview per beneficiary. Laurent presented you in the legal parts the different cost categories that we have in actual cost grants. Here, this format follows more or less the same approach. So in a lump sum grant, even if we do not have any cost categories anymore, there is no financial audit. We need to build a proposal following a specific structure, and we use exactly the same structure as we use for actual cost grant. You will see all the cost categories. So for each cost categories, you need in your proposal to present the number of person months you will have, at what price, what costs, equipment, all this kind of thing. And for each tab, you will have the overview of the beneficiary and potentially the affiliate entities. You can fill in this tab by work packages. So you will have the same copy-paste, same structure for as many work packages in which your beneficiary or the beneficiary is expecting to contribute in the action. Next slide. So here is just an example of how to present the categories of personal costs. 5% month for a senior scientific scientist salary at what's cost per person month, and you will establish that. The evaluation will make a verification as well as the level of cost per item. In this case, we are preparing statistical data to go with a dashboard to ensure that the evaluators can compare the proposed person months and price and cost in comparison with an average statistic for countries. So this is the kind of thing that we do in the evaluation to ensure that once the grant started, we can pay you without asking further questions. So there is a little bit more work ex ante for the evaluation for EDCTP3. But for you, when you start building and preparing your budget forecast, we can say that in principle, you should do the same for an actual cost grant. So here is just the reflect that we're asking you to describe everything well in a structured way. Next slide. And then after all the tabs have been filled in for all beneficiaries, you have consolidated information that you can see in a specific tab, the overview where you see total person months. So this is something you can see. You have summary table with the work package, giving you the overview of how many person months you have. Then if you go to the next slide. And you also have a lump sum breakdown showing the total cost of the action in terms of funding, okay? So if you have a funding of 100%, then it will be the total cost will be everything will be funded. If some action you have 70%, for instance, then you will have only the part that will be financed by the organization, by the GU. And then you have this overview of all contribution, all requested contribution for each beneficiary for each work package and giving you the total requested contribution at project level. Next slide. So this is the end of the presentation. I think I saw a comment from Lara saying that there is no question. Is that possible? So anyway.
Not that there's no questions.
Because then I would be very surprised. But in any case, now I'm available for answering to the question. Thank you for your attention.
Okay. Thank you so much, Vincent and Sylvia. It means that you just presented very clearly. There doesn't seem to be, or there was maybe one question. Sorry, colleagues are just highlighting. There was one question, but I believe it was addressed, and another one about why lump sum is not extended to RIA. Maybe you wanted to just explain that one, Vincent.
Oh, it's a long and interesting topic. The thing is, we are planning to extend to RIA, but as lump sum is generating kind of changes in the internal process, and as we can also consider that RIA, if we take in particular clinical trial, we know by experience that Commission has implemented some RIA with lump sum. It's a bit more complicated, requires a bit more amendment process. So we wanted to start smoothly with a pilot last year, extending this pilot for CSA this year, and if possible, from next year, we will start implementing with RIA to continue the test, but we want it to be smoothly because the first thing, it works for our specific beneficiaries and organization in the global health, and then implementing progressively.
Great, thanks, Vincent. So we're going to bring back some of our colleagues that were with us earlier, because we'll continue now with the most upvoted questions in these last, let's say, about 14 minutes. And we're going to try and wrap up dot on time. So we're going to bring back Jean-Marie, and we have Sylvia, Laurent, perhaps, and Augustin for now. And let's just see, there's a few questions that have still been upvoted. This one I think is maybe more for you, Laurent. It's about whether a proposal that leverages another EU project, whether that would count as co-funding, as long as they can articulate the particular contribution. It's an interesting one.
I'm not sure I understand the question fully, but are we talking maybe here about activities that would be shared that are already in another project? So I understand it this way. Yes, as such, that's not an issue. In principle, yes. I mean, if you have activities under our project and costs are not reimbursed by the GEO, so you generate ICOP under the project, that's totally fine. It's not. I mean, there is no hurdle, because these activities are also under another EU project. And even if you get, in fact, funding, for example, by an EU agency, you could still actually generate ICOP in our project based on that. So if I understood it well, the answer would be yes, fine. I hope I understood it well. If not, we will take it later.
Also how I understood it, but let's hope so. That was from Sarah Churchill. I hope that addresses that question. So then we have one that will be more for Jean-Marie or Sylvia. This is about when it reads large implementation studies, what would large refer to?
Yeah, that's a good question. So I guess you're referring to large scale implementation studies in some of the topics we have. I think simply in the context of some of these topics where implementation research is in scope, there is no clear definition where we can say it is large when it targets X number of countries, for example, but it's related to the stage of expansion of what you are implementing. If it is a product which just finished R&D stages and is the first implementation study that you have, it is a small implementation study. But if it is expanding to validate from country to country, including different populations, different countries, different regions, it is large scale. But if it is just out of R&D and focusing on a small population, one country, one region, it is still small. But here I'm talking about things which I do not have the mandate to declare. It's, again, I say this often, it is the responsibility of the applicant to make the case for evaluators to be convinced. If we have said it has to be large scale implementation, make a case for our evaluators to see it as large scale. But if you are in doubt, if you are in doubt of what are the differences, I think I would refer you again to that call text, which may give more insights because it could relate also to the stage at which your product is in terms of the R&D pipeline.
There's another one probably for you or Sylvia here. What is the expected technology readiness level at the start and end of a project for the 2026 RIA calls?
Right, maybe Sylvia can come in quickly commenting. I think some of those topics where we have indicated the technology readiness levels at the start, I think we have 8, TRL 8 indicated. And at the end, it's up to how you will build your project, where you want to bring the technology to. But the starting has to be 8. So we do not, we insist that we want things which are not starting from scratch, that have reached a certain validation level. So TRL 8 is the level at the start, but at the end, it's up to the proposed research to tell us where they want to bring the product.
Okay.
Sylvia,
did you want to add anything?
Nothing to add to your answer. Thanks, Jean-Marie.
Okay, great. Thanks. So this one might be more for you, Laurent. There's a couple of questions from an anonymous participant and Annette, again, Annette Mahan, around Switzerland's eligibility for funding. So, of course, Switzerland is now associated to Horizon Europe. Annette's question specifically, well, both questions are asking whether they can participate in the consortium as a coordinator. And Annette's question is specifically asking whether aspirant country members that are currently eligible to receive EDCTP3 funding under the work programme, whether aspirant members of the EDCTP Association are eligible to receive funding under the programme. Well, Switzerland, of course, is one of them, but the other ones, I guess here right now, we're just talking about Angola, but maybe you want to comment on this.
Okay, so in the case of Switzerland, so indeed associated to Horizon Europe, so absolutely no problem now to receive funding and to be coordinator, because if you follow our funding regulation, there are certain requirements and restrictions, in fact, about what entities can be a coordinator. Well, it's permitted to have an entity based in an associated country as coordinator. So Swiss entities can now actually lead consortia. When it comes to, I mean, anytime we have a question about the coordinator, I also want to mention that we have a requirement for scientific project leaders in research and innovation actions. And this means that if the coordinator is not in a sub-Saharan country, there needs to be a scientific project leader based in one of those EDCTP countries of sub-Saharan Africa. So if you have, for example, a coordinator in Switzerland, this coordinator needs to team up with an entity, an organization in sub-Saharan Africa that will have a co-leadership on the scientific aspects. And we give some guidelines in our work program about what this means and how the tasks are shared between the two entities. But concretely, it means that the Swiss entity would definitely have all the, the main responsibilities of a coordinator, as always, will disperse the payments to the other beneficiaries. But when it comes to the scientific aspects, the scientific leadership of the project, it would have to be shared with a scientific project leader. So I prefer to mention that aspect. Now, when it comes to entities that are based in an aspirant aspirant country to become a member of the EDCTP association, unless this country is at the same time an associated country to Horizon Europe or an EU member state, these entities would not be eligible for funding. So you only become eligible for funding from the moment your country, if it's based in sub-Saharan Africa, from the moment your country is really confirmed fully member of the EDCTP association.
Yeah. A bit related to this is a question around if the consortium plans one of the activities in a country that's not associated to EDCTP association. Here, I assume they mean, can the consortium plan for budget targeted to these activities? It relates to what you were just saying. Yeah.
Yes. I mean, now we have to look at the situation. It depends a bit about the entity concerned, because it's possible that you have cases where your organization is based in a country where you would be eligible for funding, but you may have some activities taking place or partly taking place in a country where entities are not eligible for funding, but what matters at the end is where the entity that incurs the cost is based. So yeah, in principle, you should still be okay. But yeah, to be clear, entities that are based in countries where they're not eligible for funding may not have costs covered by us in principle.
Okay, great, thank you, Laurent. Okay, we have about 5 more minutes. There's a couple of core-specific questions here. This first one is more for you, I think, Sylvia. It's around the digital health and AI call, and it's a 2-part question. One is whether it's mandatory that the digital tools support decision-making, that the digital tools supporting decision-making, data management, and patient pathways for infectious diseases, or can it be broader within the health system strengthening and non-disease specific? And the second part of the question is whether it's mandatory that AI is already part of the digital tool part of the proposal. Sorry, did you get that, or do you want me to repeat it?
Well, they are quite specific, so I think I prefer to have room
That's
for
fine.
thought
You want to respond
on
in
those
answer?
two.
Yeah, okay.
Yeah, we will respond in written afterwards. Thank you.
Okay. Then we move to the next one, which is probably for you, Jean-Marie. I think this one is maybe quite quick to explain. Our colleagues actually already did a bit, but why we excluded TB from the HIV call when it's the most important comorbidity.
Okay, yeah, indeed, that's simple, because we have another topic on TB, and we exclude TB from that HIV co-infection because the risk is that you then receive applications that are exactly the same to both calls. So if you have a TB work to address, just go to the TB topic. HIV comorbidities, it can capture other, but not TB. So it's just because we had another funding allocated to TB.
And there's a thanks, Jean-Marie. There's a sub question to that one that you might want to just quickly explain. It's related to the EDCTP Knowledge Hub, IBA. Someone's asking whether it's 1 stage or not, whether they can submit an application for that. Maybe you just want to clarify that one.
Yeah, quickly. So as I mentioned earlier, this is a grant to an identified beneficiary. So there is someone, an entity that gets invited. It's a closed call. An entity is invited to submit to fill in a template. It's in 1 stage, and they are not in competition with the other applicants, but there are guidance. It's an instrument which is used. It's not used often, but it exists. So you don't have to worry. If you are not invited to that topic, you don't have to worry about the stages. But it's for you to know that it's a closed call where you come in this case, 1 stage. But once this grant is known, is selected, it will go through peer review. Maybe this is important to clarify. It's not guaranteed that these applicants will get the funding. They still have to do the work. They get evaluated. They get feedback. If it's not complying with the requirements, it can be rejected. If it's not fulfilling what we're looking for, it can go back. But it's you don't have to worry if you are not identified and invited to this topic.
Thanks, Jean-Marie. There's a couple of questions around eligibility, but I believe they should have been, I think they've been sufficiently addressed. There's one maybe for you, Jean-Marie, on the Global Collaboration Action for TB, this call that's with our contributing partner, Leprosy Research Initiative. And the question is around that the call mentions that the objective and funding of the leprosy-related objective can be included in the proposal with a total indicative JU budget of 5 million. And the question is this budget on top of the TB budget? So I think just to clarify the call budget for this.
Yeah, so it will be one proposal which can be inclusive of Mycobacterium TB or Repra. So that indicative budget, it is for the whole project, not to separate TB and the Repros into 2 things. I guess I'm getting the project right. So the objective of the funding primarily is targeting TB, But as I was mentioning, we know that in some cases, TB programs are coupled with the leprosy programs. So maybe naturally they do that research together. So it can be just integrated in the same proposal as a work package, for instance. And that 5 million would be the overall.
Great. Thank you so much, all colleagues. I'm afraid now we've come to the end of the time for this Q&A. There's a lot of questions still, but as we mentioned, we will do our best now to respond to those in writing. So now we will just wrap up, I think, and I just will say thank you so much to everyone that's joined us today and actively participated with your questions. It's incredible to see we still have almost 900 participants with us. So thank you for your endurance through this long session and your interest. We really appreciate that. I also don't want to forget all of the colleagues behind the scenes who you haven't seen on the screen today, but that have worked tirelessly on the preparations and with responding to your questions in writing and ensuring that all went smoothly today, even with some of the technical hitches that we had. I hope that you found it a smooth experience. And all that remains is to wish you good luck with your applications. We're really looking forward to receiving high quality proposals in the coming weeks and months, depending on which core you're planning to apply to, and to funding some great innovative projects out of this. So you can still continue to send us your questions through our applications mailbox. As we mentioned before, we will continue to update the Q&A on a weekly basis and to publish this. You'll find all the recording, the presentations, the questions and answers on the event page, and we'll be sharing it with all participants afterwards. Thank you very much for your attention, and we wish you a good remainder of your day. Thank you. Bye-bye.